All right, good afternoon, council members and members of the public joining us in person and online. I am Megan Marshall. I'm the Executive Officer for the California Interagency Council on Homelessness, and I have the pleasure of opening our meeting today. Thank you all for your commitment in joining today's council meeting and all of our efforts to end and prevent homelessness in California. My sincerest apologies for those of you who are coming from cooler climates. This is just insane. So I saw Dr. Cushel put her blazer on. I will not be putting a blazer on. I'm a native Sacramentan. This is ridiculous. So a few reminders before we begin. This is a 3-hour meeting, and while we will do our best to keep that time frame, there is a possibility it will go over. If you're joining us in person, please, or online, I suppose this is a good reminder for all folks, please feel free to stand up, stretch, move about the room. This is a very long meeting. Prior to this meeting, council members were provided a briefing packet, which also is available online on our website. We will have that link available at the end of today's council meeting. And we will try to leave some time towards the end of the council meeting for general questions from council members. But if we do run out of time, please feel free to reach out to CalICH staff with any questions. We'll provide that contact information at the end of the meeting as well. All right, so if we can go to the next slide, please. Oh, am I manning my own slide? Thank you. I was like, Claire. Okay, yeah. So today's agenda is very packed, very exciting though. We'll begin as we always do with a call to order, our tribal land acknowledgement, and a roll call. A review and approval of the consent calendar. Our wonderful co-chairs starting us off with some inspiring remarks. Some depressing updates from your executive officer, I'm afraid, but then a very uplifting message from myself and staff on our CalICH mission, vision, and values, presentations from our lived experience advisory board with their priorities, our action plan, public and tribal input, and general public comment. All right, during today's meeting, there will be an opportunity for general public comment. As I just mentioned, we will allow for a maximum of 2 minutes per comment. We welcome all public comments and feedback. However, due to the structure of the public we are in, we may not be in a position to respond to them directly today. For this reason, if you have any specific questions you'd like answered immediately, please reach out to us via email. That contact information will be provided at the end of today's meeting. So with that, the California Interagency Council on Homelessness is hereby called to order on this day, June 12th, 2024 at 1:09 p.m. I will now pass it to CalICH Tribal Liaison, Vivila Blossoming Bear, to read the tribal land acknowledgement.
Thank you. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, the Valley and Plains Miwok, the Nisinan people, the Patwin Wintun people, and members of the Wilton Rancheria tribe who have inhabited this landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants, as we recognize that wherever we're joining from in our virtual community, we're all on California Native American land. Thank you.
Thank you, Vivila, and we look forward to hearing from you later on in today's agenda. So will CalICH staff member Claire Bannerman please call the roll?
All right. Hi, everybody. So this is the attendance roll call for the council. We need a majority of members to hold this meeting. Council members, after I call your name, please say present or here. Apologies if I mispronounce any names. Tamika Moss.
Present.
Dr. Mark Galley.
Present.
Tomas Aragon. Hannah Azamati. Michelle Bass. Elisa Becerra. Gina Buccieri Harrington. Stephanie Clendenin. Susan Damaris. All right. Tina Johnson Hall.
Present.
Thank you. Margot Cushel. Veronica Lewis. William McGee.
Here.
Ricky Hammett. Zachary Olmsted.
Here.
Rebecca Rowan O'Shaughnessy.
Present.
Lindsay Sin. Tony Tavares. Or no, apologies. And Joe Xavier. Thank you. Okay, I believe I got everybody. I know we've got a few designees. Okay, so we have a quorum and I will move on to the next agenda item. Next slide, please. Agenda item 2 is the consent calendar. The consent calendar is for regular and non-controversial items to be approved by the council via a vote. We do not expect discussion, but council members may engage in discussion on any items they so choose to do so. We have one item, the adoption of the March 27th council meeting summary. Are there any comments from council members? Okay, next slide. Since this is an action item that will result in a vote, we will now open it for public comments. Please keep comments to the items on the consent calendar only. If your comment is not related to the consent calendar, there'll be time for public comment at the end of this meeting. If you are connected through Zoom, please select the raised hand icon. And for those on the telephone, please press *9 to indicate that you would like to comment. And I will instruct you to unmute. All right, just checking. And no hands raised online. Great. So there are no comments. Would anyone like to motion to approve the meeting summary? All right, thank you, Susan. Thank you. And do we have a second? Thank you, Director Xavier. All right, so we have a motion to adopt. We will be voting through raised hands. The categories will be as follows: yes, no, and abstain. So for those voting yes, please raise your hands. Great, thank you. Those voting no? And those voting to abstain? Great, thank you very much. All right, the motion passes, and I will now pass it back to Cody Ziegler to facilitate the next item. Or Megan Marshall.
Just for ease of access, although I know Cody does a much better job at facilitating, but we'll move us on to our next agenda item as soon as Claire sits down and can advance my slides with our co-chair opening remarks. And so with that, I will turn it over to, I believe Secretary Moss is going first. Fantastic. Thank you so much.
Thank you so much, Megan. Good afternoon, everyone. I'm really excited to see you all. Welcome to our new council members. Really thrilled to have your wisdom and expertise join this illustrious group. I first wanted to say that I'm really excited about today's meeting because it marks sort of the beginning of several meetings we're going to have over the next few months to really update our 3-year action plan. And for me, the action plan is a chance for us as a body to be the sort of all government approach to addressing homelessness in the state of California. And we have had tremendous work happen up to now, but I think we have a really amazing opportunity to shift into a much more goal-oriented process around how do we collectively, the assets around this table, take a human-centered approach of how we are actually trying to prevent and end homelessness in California. So it is extraordinary the work that your departments and agencies do already, but I don't know that we have really figured out how to collectively bring those assets together and set goals for how we want to end and prevent homelessness in California. And so it's, to me, marks an opportunity to make real what we know is necessary to address this crisis, make it urgent, and make it a collective process. And so I'm really excited for all the work that the staff has done to prepare us for today's discussion and what's ahead. The other thing I'd say before I turn it over to Secretary Galley is, we spent some time thinking about, why this work matters to all of us, right? I believe as state public servants, we are committed to the mission of serving Californians in the best way we can. We believe in the mission of the council, and you're going to hear Megan talk a bit more about really solidifying the vision and mission for Cal ICH. But for me, it really is about how are people experiencing their communities. How are they, if you are a mom with 2 kids and you're living with your elder and you are trying to access services in your community, what is that experience like for you? And so when I talk about human-centered approach, it's really about how does a person interact with all of the things that we do every day and thrive in California, because we know that the access to thriving is unequal. We know that certain communities are disproportionately impacted. And so I'm really excited to bring our creativity to the table, to not just talk about our programmatic outcomes and outputs, but to come up with a collective strategy for this body to be representative of the all-state approach to addressing this urgent crisis. And I said it was one more thing. I got one more thing just to say. I think that the housing affordability crisis is one of the most the biggest challenges for the state of California reaching its full potential globally, locally, nationally. And we have a chance, all of us, to do something about that. So I'm really excited to roll our sleeves up today and continue this conversation.
Thank you, Secretary Moss, and really just want to lift up especially this notion of the action plan. And, you know, I know, like you and like many of you, we sit on a lot of councils. We get to come to meetings like this, and sometimes it's hard to put your finger on the action piece. And I think the discussion today hopefully deepens our ability to be active in this work. And that means, again, we're not the council. This isn't the plan for how we analyze or how we just look at outcomes. This is really how do we bring the resources and the vision and the leadership around the table to action to end homelessness in California. And I really did appreciate too how that ability to do that is not equal across groups, across regions of the state, and how do we use our statewide lens, not just to think about LA and the big cities, but some of our smaller, more rural areas. How do we link and connect dots in ways that we haven't before? I'll go somewhere you didn't, but I know it's on your mind and heart as well. So we're in a tough budget time. We're making some tough decisions. The administration, the legislature, thinking about what we do that we've always done, what we might have to cut back a little on. But I will tell you, no matter what gets a little haircut or doesn't get done right away, there is no change in the mission and vision of the administration as it comes to this issue. And it's exciting to think about the role of this council in the tougher time. How do we get more galvanized, get more focused? And I think that's more reason to think about how we sort of mobilize into action. On the sort of programmatic note, I think there's been a lot more work done around Prop 1. I know with Secretary Sin, thinking collectively across our three agencies, how do we manifest the vision of the voters and this administration and our leadership in Proposition 1? Yes, there's some bonds. Yes, there's the reformation, if you will, the modernization of the Behavioral Health Services Act. That's, I think, really heavy on people's actions today. This is an amazing opportunity to bring ongoing resources for housing. This is an amazing opportunity to connect services to the housing resources, and we often see them not connected, but that starts in the work. Director Boss is here in her department doing so many important things in this area, pushing our federal government around transitional rent and this idea that, yes, rent and being housed stably is part of being healthy and achieving health in California, thriving, as you said, Secretary Moss. So there's all of these exciting threads that are happening that link into the other work around this table. And even though I think there are some heads hung a little lower because of some of the budget challenges we're seeing, I encourage us to still try to lift up as much as we can and see the opportunities even in these tough times to figure out how our values and our principles still carry out in everything that we end up doing. So not that I expected to give everyone a pep talk, but Maybe I need it for myself more than anything, but I think there's a lot still to be really focused on and moving forward as we sort of get this budget figured out and keep the values that I know all of you bring to this table moving forward. So yes, like you, I will say one last thing. I'm looking forward to the discussion around how we engage and more thoughtfully used our lived experience advisory board, because as you said, Tamika, this is about how people, real people with names and in community thrive. And without those experiences really informing us, challenging us, pushing back, in both respectful and not always so respectful ways on some of the things we bring to the table, I think is going to be really important. So I'm looking forward to that part of the discussion for sure. Megan, take it up.
Thank you, co-chairs, for those opening remarks. I will say, Secretary Moss, took me right back to Social Work 101 with a vignette. So much appreciate the flashback with the discussion of the woman with children who's living with an elder relative. So with that, I'll begin my executive officer updates. If we can go to the next slide, please. Thank you. These will not be on slides, but as many of you are aware, the Joint Legislative Audit Committee requested an audit of the state's homelessness funding and evaluation of the state's efforts to monitor its cost effectiveness in the spending. So the question that was posed by the California State Auditor was, is the state able to determine the cost effectiveness of its homelessness programs? The final report focused primarily on Cal ICH and programs that have not yet completed. HAP 1, for example, ERF will conclude at the end of this month. And so Cal ICH felt very strongly, as well did agency, that it's hard to determine the cost effectiveness of programs that are still in progress. But however, the final report included 3 recommendations for Cal ICH to consider. Some of these are a little bit longer than others, so if you can just bear with me. The first recommendation was to ensure that its 2024 update to its action plan aligns with its statutory goals. The Homelessness Council should clearly identify in that update the statutory goal or goals that each of the action plan's objectives addresses. And so for those of you who have been around for some time on the council, you know that we have 18 original statutory goals for the council with a 19th added in 2021. And so Cal ICH generally agreed with the auditor that we can reasonably incorporate how we track those goals and those statutory obligations in our action plan. Many of you have already had conversations with Cody and his team on your individual departments and the ways that you all are assisting the state in ending and preventing homelessness. A few iterations from now, this is a long-term conversation, just as a reminder, but a few iterations from now, we'll have some conversations around which departments are really moving us towards which specific goals that are set in statute for Cal ICH as a body. The second recommendation is to promote transparency, accountability, and effective decision-making related to the state's efforts to address homelessness. That the council should request that the state agencies responsible for administering state-funded homelessness programs provide spending and outcome-related information for people entering, experiencing, and exiting homelessness. I'll just take a brief pause there to say AB 977 sort of reconciles some of that recommendation, and that all state programs that are funding homelessness programs are required to be entered into HMIS, which then for some of you are aware, and if you attended the March 27th, 2024 council meeting, you saw some of the dashboard presentations that we offered. We have that data now. What we don't have and what HMIS does not collect is fiscal information. And so in general, Cal ICH agreed with the auditor's recommendation, but noted that it would need additional resources in order to fully actualize that recommendation. Would also require additional statutory authority to do so. I can kindly ask Director Bass, please, could DHCS tell us what your expenditures are for, first quarter, second quarter? I have no authority to do so. So we noted for the auditor that We don't have statutory authority to require its council member departments to report fiscal outcomes for its AB 977 programs. And the third recommendation is to ensure that the state has consistent, accurate, and comparable data for all state-funded homelessness programs. By March 2025, the Homelessness Council should work with COCs or continuums of care to implement standardized data requirements that programs must follow when entering information into HMIS. I can happily report to the council that those efforts were already underway at the time that the audit concluded, and we just provided our 6-day update to the California State Auditor's Office to say that has been fully implemented. So we have provided COCs with that information. AB 977 dashboards have been rolled out. We have these things fully implemented now. So I will take a pause here if the council has any questions regarding the audit or words of consolation. Great. Okay, I'll end with reminders to the council that CalICH grants and grant staff are transitioning to our sister department of Housing and Community Development as of July 1, 2024. Those programs include HAP, ERF, and FHC, a lesser known program, but it's the Family Home Lunch Challenge Grant. CalICH and HCD has been working towards this transition for the better part of this fiscal year. And I'd like to take a minute to acknowledge HCD leadership, Zach Olmstead, Megan Kirkby, and Sarah Poss, who is in the corner there, for their partnership in the significant transition of staff and resources, tremendous resources. I'd also like to take a minute. I don't think we have any grant staff in the room, but I'm sure there are many online. So would like to take a minute to acknowledge CalICH grant staff who are joining HCD. Your dedication and passion for this work is very apparent, and I'm very excited to see how that transforms under HCD's leadership. So with that, I will pass it back to who is probably going to pass it back to me. So I'll just continue on. If we can go to the next slide, please. All right, so I'm going to spend some time on this slide with a lot of words and very little on the screen. So CalICH was first authorized in 2016 and was known as the Homelessness Coordinating and Financing Council. As that body, the council had 18 statutory goals, including the oversight of the implementation of Housing First, and very importantly, I would say, is to make policy and procedural recommendations to legislature and other government entities. In its existence, CalICH has not made recommendations to the legislature or other government entities. In 2021, Governor Newsom signed Chapter 398, Assembly Bill 1220, which renamed and restructured the council, which included the co-chair structure that we have now, with Secretary Galley joining the BCSH secretary. And to continue the forward momentum and the state's commitment with leadership at the table for ending and preventing homelessness in California. So recognizing the transition of grants to HCD, we took this as an opportunity to reintroduce CalICH, not just to state departments, but to our colleagues in the cities, counties, and continuums of care that we all hope to support. My team and I weren't quite there yet, but thank you, Claire. So my team and I began a series of visioning sessions to really reestablish ourselves as CalICH as a body, separate from the work of the council. So for example, HDIS, which is the state's system for collecting data from HMIS, is not overseen by the work of the council. So CalICH as an entity has a tremendous amount of work and requirements that are separate and distinct from, but relate to the work of the council. So this resulted in our first ever mission, vision, and values, next slide, please. Thank you. All right, so very simply put, our mission statement for CalICH, and again, just as a reminder, this is separate and distinct from, but in support of the work of the council. Our mission is as a statewide facilitator, coordinator, and leader for policy development and research for the state, local, and tribal partners in their work to prevent and end homelessness in California. Our vision is that CalICH is motivated by a vision of a future in which homelessness is rare, brief, and a one-time experience in order to prevent homelessness in California. Next slide, please. Our values are, I would say, few but many, but equally we value purposeful and action-oriented leadership and collaboration across council member departments and agencies, meaningful partnerships with local jurisdictions, the pursuit of racial equity and justice, the expertise of persons with lived experiences of homelessness, housing first as an evidence-based practice, trauma-informed care and person-centered services for the full diversity of people experiencing homelessness, the autonomy and self-determination of California's tribes and addressing homelessness in their communities, and last but not least, accurate, actionable, and honest data analysis. Next slide, please. All right. Who does CalICH serve? It's been a really big question for us. And so we have found ourselves to be in service of state departments, local jurisdictions, which includes cities, counties, COCs, and tribes, and the public. I will make a note on public here. So as you all are aware, CalICH does not administer direct services in the same way that our colleagues at CDSS or DHCS, by way of counties. But what we do provide are connections to those service providers who are doing those direct service connections. Next slide, please. What services do we provide? Coordination and relationship building, policy development, data and research, and technical assistance. And all of these services have been identified through our assessment of what exists in statute. So of all of our statutory goals and obligations, these are the 4 buckets that we exist in. So post-transition of grants to HCD, CalICH will have 3 divisions, providing unique offerings across these service areas. Those divisions are statewide policy, of which this council is very familiar. It is overseen by our dear director of statewide policy, Cody Zeger, as well as our local initiatives and our research and data division. Next slide, please. All right, so these next few slides are going to provide an overview of current and new services in each one of those divisions that I've just named. We'll start first with statewide policy. So current services, and you'll see at the header there, each one of our partners, or the persons or the entities that we provide services to, are named. So for state departments, our primary functions are to coordinate and develop relationships, policy development, data and research, and technical assistance. Hence the division name of statewide policy. They really focus on state partnerships. Next slide, please. New services, however, I will note here, are a number of technical assistance offerings. If you look at the bottom of that screen there, for a variety of audiences on Housing First. Housing First has been in statute since our existence in 2016, but it has not been something that we have really discussed publicly, openly with our cities, our counties, and our continuums of care, but is an incredibly important component to our work. If we can go to the next slide, please. All right, with our local initiatives division, current service offerings are in coordination and relationship building, technical assistance, for a multitude of entities in the state departments, local jurisdictions, and somewhat in the public, but more exciting development in the next slide. So I'll spend a little bit of time here, not so much on what exists on the slides, but to say we're aware that communities are struggling with relationships amongst one another. We're aware that cities and counties have a relationship on paper, but not necessarily in practice. And so what we're hoping to develop in our division of local initiatives is that bridge in communication. So thank you for your application to HCD moving forward for HAP. CalICH's role is to make sure that what you've said on paper, what you've put in an MOU, what you've put in an action plan is really actionable and is truly happening. So we've had a number of communities who've reached out, both cities, counties, a few COCs, I will say, who've said, we're really struggling with relationships with our city. We're really struggling with relationships with our county. We can't get data from our COC, which is very different from what they've said in their application for a significant amount of funding. And so what we're looking forward to for this particular division in the next fiscal year is Cal ICH bridging that gap? So I will just highlight a community who has agreed to be highlighted in public. So the city of Oakland has said very publicly they're struggling with relationships with the county of Alameda. Cal ICH has a series of meetings scheduled with city leadership, county leadership, and COC leadership to see what can be done to reconcile those confusions, those role clarities, etc. So all of those things will exist in local initiatives moving forward. Next slide, please. All right, last but not least, you heard from our director of research and data in the March 2024 meeting, who is now on maternity leave, but we're still very excited for the progress in this particular division. So it has been very reactionary. Current services have been either driven by statute or driven by request. And so if we can go to the next slide, I'll highlight what we're doing to be proactive. Is standardizing data sharing agreements with council member departments and agencies, not just those who request, but as a standard of practice. And so CDA, for example, has not made a request of data sharing, but that is something that we will proactively seek, knowing that older adults are overrepresented in our unsheltered population. What can we do? What does the data tell us? How can we be better informed with our policy for that particular community? Next slide, please. All right, so we have a few discussion questions here for council members. But before we move to that section, any questions on mission, vision, and values of Cal ICH as an entity that supports the work of this council? And I can certainly be the mic runner.
I think we do, yeah. Thank you for the presentation. Quick question, and how much time do you have for questions? I don't want to derail us because I know you have questions you want to say.
We have time. Cody tells me we have time.
Okay, so I believe, would you be able to talk a little bit about the technical assistance? I had typed up something about housing first, and I believe I heard you all state, or heard you state that you all provide technical assistance. Would you go into maybe a little more detail for me? I don't know if anybody else needs it.
Sure. So it's been very reactionary. So entities that are requesting, I think, for example, we had a question come from a nonprofit recently that said, our county is interpreting housing first in this way. Like, is this correct? If it's not, could you please connect with the county to ensure they're utilizing the correct definition? Proactively, though, we'll be hosting some communities of practice so that COCs, cities, counties, those who are responsible for programs that are required to utilize housing first, have an opportunity to come and hear directly from Cal ICH what that means. Yeah, thank you. All right. Hearing no other questions, I'll move on to the discussion questions. And so you've heard Cal ICH's mission, vision, and values and the service offerings at a very high level of what we can provide to each of your departments. The way that we've sort of framed the action plan discussions that we've had with each of you is, we understand that this is what you do. How can Cal ICH help you do that and potentially more? And so the question that we have for you today is, how can Cal ICH support your agency or department's particular mission? Just for the group as a whole, this is a public meeting, so yeah, please, but certainly have sidebars where necessary and come back to the group.
Hi, Rebecca Shaughnessy from the California Community Colleges system. So I think, thank you so much for Megan for the update, and I'm very excited to see many of the new services that Cal ICH is committed in offering. And I will say right off the bat, some of the challenges for our programs, for example, we have a very small program around rapid rehousing, and housing first will come up, right? Really, how do you think about housing first in a academic setting, which is time limited? right? So what does that look like? And when we design our programs, the criteria, so any kind of professional development in that space, and also thinking about it in a, academic in education context would be really helpful. And then I think, and I would like to echo kind of really this meaningful partnership at the local level, what that looks like. Typically, it depends. Okay, maybe that's a cue for me to stop talking too, but it's the local partnership. Currently, we leave it to the local colleges. For example, if they have been an active player in the community, then perhaps they're plugged in the meetings because the individual from the community college, has a great partner with the individual at the county level, right? So it's very much individual based, but how do we systematize that? How do we create some kind of blueprint for conversation, right? Any kind of MOU. I think that type of toolbox will be really helpful for our colleges. And then also another learning for our rapid rehousing program, which is still a pilot program. We see that some rural colleges, it's just there's no partnership. So that's a reflection with her. They're like, we cannot find any partners, in the proximity of our colleges. So we will have. So I think any kind of support, right? Again, on the local partnership, from the partnership exploration to partnership engagement, will be really helpful.
I really appreciate those comments. I will say, having come from almost 20 years of service in county government, you're absolutely right. Counties absolutely have to make themselves available to the entities that are either serviced or overseen by members on this council, honestly. And so we have opportunities to do that in the funding that we make available, particularly the flexible funding that we have available through HAP, through ERF, Family Homeless Challenge. I remember a very long time ago when I worked for Sacramento County Department of Human Assistance, who's the welfare entitlement administrator for programs through CDSS, when legislation changed that allowed for college students to be eligible for CalWorks. And that was such a small thing when you think about it. Like, we're talking $132 a month at the time, $137 a month, but monumental for the student who was receiving it. And so making those connections between, I think, the departments and agencies that exist on this council, and making those direct connections in the communities where you all serve is critical. Yeah, thank you for that.
I'll jump in again. William McGee with the California Department of Education. So I believe in response to that first bulleted question about supporting our department's mission, it would be very great on integrating education more into the conversations. And so figuring out how the Department of Education can be at the table, since we do have children who are experiencing homelessness, and they come with their families that are in the communities that we all serve. I think the other question is the HMIS data, if there will be anything to include data from our county offices of education and how that can be a part of what is happening. We support the Homeless Educational Technical Advisory Centers throughout California. And so they support the county offices who do the work in the school districts. One of the things that I would say too is it would be great to figure out how we can get agencies to visit some of the work that's happening in the school districts. Myself and one of my team members went to visit San Francisco Unified School District, where they have the stayover program, where that school actually allows families to sleep at the school site in the evening and on the weekend. So how can that be replicated? How can we look at what's happening at the junior college? But then how can we bring that together so we can talk about what services and support our families need?
Thank you for that. And I am vaguely familiar with that program. And I think the local public health office also does regular visits for families who are having to stay overnight on the campus. And so when we think about like the touch points for each one of the departments and agencies that are represented on the council, it's more than, your financial investments, more than your budgetary investments. it's also should be representative of what counties are administering, what cities are administering, and the uniqueness that exists across the state. So thank you for that, council member. Councilmember Lewis.
Thank you for the presentation. Two things. One, just as an organization that serves hundreds of families at a time, I think that one of the big gaps is across the state is the inconsistent administration of the McKinney-Vento Act and all the rights and resources that school-age children are supposed to have. And so, not to put things on your state department, but I think there's a huge gap and maybe some additional support for the state to support the local jurisdictions to make sure that that's happening, because it really is inconsistent and a lot of children are being displaced, their education completely interrupted. And folks, and even though I know there's McKinney municipal representatives in schools, it's not, I think, to the level that it could be to make sure that education is not interrupted for, unfortunately, the increasing number of families that are finding themselves homeless because of the economic landscape. And then the second thing, more broadly, I know you're asking the question now, but I'm really hopeful that when we get to measurable, actionable goals in the next action plan, and the identification of which departments are going to be working on which goals, that can help drive some of the access or requests from departments for some of the new services that you're offering. So I think they should go hand in hand, because even though folks, I think, understand what they need, I think as we really try to move the needle on having more measures, I hope that this can be a part of that.
Thank you so much for that. And that's certainly an area and space that our Division of Local Initiatives can work within in partnership with CDE. So, where are these liaisons existing? Where are these resource centers existing? And do they have adequate connection and connectivity to their cities or counties or COCs? And if the answer is no, then Cal ICH has an obligation to inform our funders, which in this case, I'm looking at Zach Olmstead in the corner there, HAP, ERF, and FHC are moving over to HCD. If we know that there's a particular city, county, or COC that is not making themselves available to working in the greater partnership in areas that demand it, Cal ICH has a role there to ensure that there is a connection, and if not, that we're informing the funding entity that they're, for whatever reason, refusing to or inadequately making those connections. Yeah. Thank you, Councilmember McGee.
I just wanted to lift up the technical assistance piece and really talk about, a lot of our local partners actually want guidance from the state around how to administer these resources and programs. And sometimes it gives locals cover to make hard decisions locally to move forward with homelessness strategies within their communities where they may be getting pushback. So I'm really excited for ICH to actually work with local jurisdictions to help them think about braiding resources across the council member departments and agencies, so that no one program or funding source is going to solve this problem. We actually have to help jurisdictions think about what resources across all of state government, frankly, are available and at their disposal. And, not all programs talk to each other, that we have different systems across this table. But I think the value of ICH sort of leading in that space particularly, I think, as Secretary Galley said, in a down budget year, when efficiency and effectiveness of how we are organized, how our administration of the current programs we operate are going, when resources come back around, then we're ready to go and communities can see real-time impact on the ground. So I think that piece is really, really critical for deepening the offerings that ICH is going to provide.
Can I just also piggyback on that? I'm drawn to the conversations you're about to have with Oakland and Alameda. And I suspect what you might hear in some of those conversations is a little bit getting to what you said. We would like to be able to do this together, but because of this or because of that, at this table, we're not able to. A rule around a source of funding or a reporting requirement or whatever it is. And I think it will be interesting, and I will talk to Corinne about it later, but maybe ask Corinne to join some of those conversations in as much as some barrier comes up that we might as a council be able to move through. It would be really important because I know, and I hear it frequently, that the vision and even the implementation of policy at this level doesn't trickle as nicely as we hope at the level of the county or the city. And so, galvanizing this technical assistance, and not just technical assistance at the local level, but also reflection of how our own programs are structured so that we can facilitate a little bit of what they want to get done. Because I'm certain there's going to be improvements to their relationship that you discover, but also some opportunities where, they're both running into the same barrier, and it's a barrier at our end.
I will say happily, Secretary Galley, that's not the particular issue with Oakland and Alameda. It is not a state policy issue, but we're certainly aware of those that exist throughout the state. Certainly for our communities that are rural and in provider deserts. We know our inland empire is almost entirely without service providers who are interested in and capable of providing the services to meet the needs of all of the programs that this council administers. I will say mostly it is a misunderstanding between big cities and counties of whose responsibility it is to do what and what those services are. I'm not pointing to Oakland and Alameda in particular, but role clarity, I think, is the highlight that I can offer there. And it is not to disparage a county, it's not to disparage a city, it is just to say city managers, city administrators come and go, electeds come and go, but what stays for the long term is typically welfare institution codes, health and safety codes. And so I find it a role and responsibility of this council, of myself in particular, to ensure that as those new electeds, as those new administrators come in, that they are familiar with the infrastructure and the availability of what exists in the greater continuum administered by this body.
Hi, Zach Olmsted, HCD. I have a couple just general maybe suggestions. One, kind of like getting in that, and then obviously since a lot of work's been coming to us, we've been working very closely together, and you are able to get kind of back in that core space. And in the spirit of kind of like that recommendation space, I think what could be quite helpful to us as agencies and departments is, as you guys are out there in the communities and you are hearing things, we need to be aware of, are they identifying, hey, this is a duplication of reporting. I have to go to DHCS for this and HC for this, that we might not be aware of. Can we find some help to communities to like ease that burden, but also make it easier for us as a state? You have that global view of departments, right? So are there programs we're rolling out that, we have a general idea of it, and especially through this work, but we're only meeting quarterly and things come up between, it's like, hey, we can find some efficiencies in the funds wording or actually reduce duplication. And so, those opportunities are kind of, given the visibility you guys are going to have and working in the communities and being freed up to do so now that kind of we're taking those programmatic functions. And then the other thing that I think is a really fertile area for consideration for technical assistance, both to us, but also the local governments and continuums of care, is coordinated entry systems. And the challenges there in maybe inconsistency in application, how to get the right person to the right intervention. It's an area that we've certainly been thinking a lot about, but I think that is ripe for kind of statewide technical assistance guidance, and then also local guidance as well. So I think that's a real opportunity for where we can see some real improvements that actually have some real positive outcomes on the ground.
Thank you for that. Much appreciated. We're certainly looking at communities of practice who are lifting up successes in particular areas. I will say one of which, of course, are persons who are connected to behavioral health systems. And so traditionally, and by traditionally, I mean back in my day when I was in homeless services as an 18-year-old in Sacramento County, it was that you could not identify somebody as having a behavioral health diagnosis that made them eligible for county behavioral health services. We're far from that day. We know communities are very successful at making connections for persons, contingent on their diagnosis, level of need, level of acuity, et cetera. And so, but Cali CH has not done enough to lift those up. So I appreciate you highlighting that. Hannah?
Hi, Hannah Zamati with the Department of Social Services. One additional idea on the first question that I had is doing more work on the strategic communications about what success looks like and thinking through like what are some of the case studies of what effective integration across different, programs and services in a given community looks like, both as a way of facilitating replication of good practice, because we've got a lot of reinventing the wheel happening across 58 counties, 44 COCs, many, many more cities and tribes. And also to give credit where communities have mastered and done good work with the resources and funding that's available to them. I think that could be really powerful, especially as we continue to try to, implement and work on continuing the commitment we have to this issue, to be able to show that there are stories of success, that there are ways in which we have made progress, even when the numbers are complicated and don't necessarily reflect that in the most obvious ways. So that was just one more suggestion.
Thank you. I appreciate that. And certainly for, our quote unquote harder to serve populations, right? And I've not found a better way to categorize that other than what's been disseminated publicly. So harder to serve persons who are coming with dual diagnosis, multiple diagnoses, who have touched multiple systems of care. And I think that was sort of the crux of what Secretary Moss started us off with. We have somebody who's touching, each one of the systems in this room or half of the systems in this room. How do we reduce the barriers amongst ourselves to better serve those persons based on the successes that we're seeing in certain systems of care? So thank you for that. All right, I will move us, we have some time, but I will move us to the next question. Certainly, if anyone has an afterthought for the first, please, I'm happy to take that. But the second question that we're posing for you all is, are there new services or initiatives your agency or department is planning to roll out in fiscal year 24-25 that intersect with the work that we've described at Cali CH? And initiatives could be something as simple as, are you planning a conference or a tabletop discussion on housing and homelessness? If that's the case, Cali CH would love to be there and love to support you in any way that we can. Certainly for our two legislative appointed members, Dr. Kushel and Councilmember Lewis, if there are things that your respective organizations are doing or planning for the next fiscal year, Cali CH would love to support in any way that we can. So I think Councilmember DeMorris, I think I saw an invitation, if I'm not mistaken, today. Yeah. So I hate to put you on the spot, but if you perhaps would like to kick us off with CDA's intention of a tabletop discussion for homelessness in older adults.
Susan DeMorris, California Department of Aging. We have saved the date. Everyone here is invited to join on October 8th here in Sacramento at the Convention Center, the Master Plan for Aging Day of Action. And we will be focusing on preventing and ending older adult homelessness, as well as building out our long-term services and support system. So you will be invited and asked to present and facilitate. Going back to the number one, coordinating and facilitating. Yep. So the save the date and registration opened this week.
That's great. And I'm almost confident that we shared our list of council members with CDA, but if not, Claire can certainly send that over so that CDA can disseminate. As I said, we have new council members. So although I think I remember Dr. Kushel presenting last year as well. So I'm sure she's on the agenda.
I also will add that we copied the council, and we are standing up a lived experience advisory board, and we've been in close conversations with you as well about that effort.
That's great. And that's a really good point when we talk about service coordination and, areas of need. I will just highlight CDPH's lived experience advisory board when Cali CH was standing up its own independent lived experience advisory board. And for those of you who are not familiar, these are lived experience advisory boards of persons specifically experiencing homelessness. And so my question was, do we really need like 11 lived experience advisory boards, or, more than 2? Do we really need? The conversation with CDPH is, yes, this is very specific. We'll take up all your agenda time, which is not something that we wanted to do. But how can we make those connections between those leaves, right? And a leab is one example. I will say tribal liaisons are certainly another example. I know CDA has I'm sorry to pick on you, Councilmember DeMorris, but these are things that are new for CDA. Has just stood up a tribal liaison position. And so how are those staff connecting amongst themselves, organizing amongst themselves, and how are we lifting that back up to the work of the council to avoid for duplication of efforts, right? Like, we're in a very tight fiscal year, probably a few fiscal years. And so economies and efficiencies are important. More important than that, though, I would say, is the time of the people that we're asking of. We're asking for persons to share their very personal experiences and their expertise with this body and other bodies as well. So how can we, as a very powerful, well-staffed council, how can we make that easier and more effective for the work that we have? So thank you for that. Any other thoughts on that second question?
The record, Proposition 1 implementation, which I just will say for the sake of the public meeting, if we do acknowledge that, and I think you're well aware of that. The other thing that's going to be and we're already, of course, working on this, the accountability on homeless resources is going to be, I think, a tremendous opportunity for us all to achieve pretty great efficiencies and to help locals from a technical assistance perspective. But then selfishly for our department, as we do some work with tribes on tribal HAP, we'll really be looking for some guidance from the resources you guys have at the council. So, which I know are of course willing to provide. So thank you for that.
Thank you for that. So we'll certainly hear from our tribal liaison in a bit here. Her position originally was intended to oversee tribal HAP. We've done a number of listening sessions. Tribal HAP was identified from those listening sessions as a best practice. We're happy to share those best practices, and certainly my tribal liaison will share all of those things with you later on in the agenda. So I think, our work with tribal communities, our work with overrepresented communities who are underserved by our systems are incredibly important. So CalICH, the tribal liaison position had originally been intended to commit itself to tribal HAP. I felt very strongly that we needed to have a tribal liaison position to represent the greater work of CalICH. It will have a companion position. Not married to a name particularly yet, but that position will work to ensure equity for populations who are overrepresented in our unsheltered populations. So we're very early. So any other thoughts? Councilmember Lewis.
Sure. Veronica Lewis, community members. So over the last 4 years, there's been deep investment in a lot of encampment related efforts. ERF obviously is the newer iteration of that in the last couple of years, but I think that there's some opportunity for CalICH. We're about 3 years in for some folks, right, that kind of continue from home key to home key and so forth. And the ERF efforts are a little bit newer, but I think that there's just, given the different types of strategies that are being tried across the state, and ERF allows some level of flexibility that we hadn't seen before really from state funding. I hope that, and given like there's a connection to behavioral health, right? And then there's the transition, there's touching all these other systems, right? And then there's the transition ultimately, hopefully, to permanent housing. Some ERFs focus just on getting people off the street and don't necessarily have a clear pathway. Some do, right? And everything in between. But I think there's some opportunity to look at all the strategies across the state in the different types of areas and to begin to understand what's working well, right? And begin to craft that possibly into some guidelines where there's significant investment California has put into getting people off the street for a variety of reasons. Obviously, Prop 1 is going to focus on a certain population as well, right? That hasn't started yet, but I just think that I haven't really heard that come up here. And I think it touches so many it touches so many different departments that are represented here. I just think we need to take a look at that if that's possible.
I appreciate that. And so ERF again is one program that's transitioning to HCD. However, Cal ICH will continue to support with data. It's still a requirement for those awarded projects to report into HMIS, which then are rolled up into HMIS. I will say so HAP again is, I would argue, the state's most flexible investment in housing and homelessness that really allows for local jurisdictions to decide for themselves, what do we need? ERF, the sole difference there is that it's cities of any size that can apply. And so we've seen incredibly small cities apply and be awarded for these funds. And we're talking, 10 persons. And for that particular city, that's the highest level of need that they have, but they had no resources outside of ERF to address that particular need. We will, the Division of Data and Research will conduct an evaluation of ERF. ERF has not yet concluded for the first rendition of that program. And so want to give folks the time from the time that you got the check in your hand to the time that folks are supposed to have been served, what have you been able to accomplish? And so certainly we're looking forward to doing that in collaboration with the inheriting department of HCD. But yeah, lifting up those best practices is a must. Having served, as I said, I think earlier in local communities, hearing smaller communities, rural communities say like, I had no idea I can do that. Like I had no idea procurement could look like this. Could you talk to my county council? Could you talk to my board? We had in Sacramento County members from LASA, from LA County come and present to our board just to affirm like, yeah, these things are possible. We can do these things. So I appreciate the lifting up of that.
Thank you. And I just want to be clear, I'm talking about all the different encampment related
Yep,
efforts, not just
absolutely.
ERF.
Yeah, I know.
We're about 5 years,
Yep.
we're about 5 years into the beginning of investment in California. So I just want to be clear. ERF is obviously the most
It's the newest.
specific one,
Sure.
but I just want to, we're about 5 years into significant investment. I think it's just important given that, unsheltered homelessness is one of the most cruel iterations of people that are unhoused or unstably housed. So
I appreciate that. And so like for the newest version of our action plan, we're certainly looking at, again, this is the first time that the action plan will make recommendations for decision-making bodies. Hey, this is what was defunded. This is what has not been funded. This is what we need. So if we have money, when we have money again, like what are the things that we're looking to accomplish? A part of that is where our efforts currently exist. And, Caltrans is a great example. I think you mentioned them. They have encampment coordinators throughout the state. And so how are those encampment coordinators adequately connected to the continuity of care that exists throughout all of our programs? Yeah, thank you, Councilmember. And thank you, Councilmember McGee, for taking my invitation to stand up in a 3-hour meeting. Yeah. All right, any other thoughts on Councilmember Kushel? I thought I saw you picked up the microphone, but perhaps I was incorrect.
Margo Kushel, the newest member, and from an outsider, I guess what I was thinking about is how much can Cal ICH not just support agencies, departments, or missions, but perhaps make recommendations of new areas of investment or coordination. I was thinking, hearing from our community college colleagues, that one of the biggest issues in implementation of Housing First is the workforce. And so part of it is, how do you, the technical assistance to braid the streams to pay for it, but partially is, are we providing the right training? Are we developing the workforce? And are there organizations at the table who might not think of that as their intersection with homelessness, but is an obvious intersection with homelessness, but perhaps they will hear from our colleagues in the healthcare delivery system of what workforce needs they have that could happen. And so maybe that's where my mind was going with this, is how much can ICH see their role also as not just supporting, but perhaps edging or recommending new parts of departments' missions.
Thank you, Councilmember Kushel. I will say, and I know Dr. Galley has just excused himself, but I will say for our remaining co-chair, Cal ICH has not made recommendations to departments, has perhaps posed questions of but could you do A, B, and Z, for example? But certainly we can explore opportunities there. Later on in today's presentation, we'll hear from folks about the work on our advisory committees, our lived experience advisory board, as well as our 5 working groups, which we'll have to expand with additional information in areas of need. I will say that it's my commitment as the executive officer for Cal ICH to do this in partnership with council member departments and agencies. The recommendations that we make are not anything but reflective of what we see as being the need. So I appreciate you that. Thank you for lifting that up. Right.
So Dr. Michelle's point, we actually may not know about.
Sure.
Administration within partnership with that's targeting effectively CDCR systems and foster. Like we may not have that, but ICH does, and so recommendations around how to either scale those programs, how they're actually the same population that's receiving healthcare services as well as transportation services. I think that's the connection that we have.
Yeah. I appreciate that, Co-Chair Moss. I will say, Cody, if you can make a note from me, Cody or Claire, I think that we should begin every meeting, not just with executive officer updates, or certainly I'm happy to incorporate that into my updates, but where we see a nexus. So if we've seen in department updates, which are available to you all, you receive in advance, I don't expect for anyone on this council to read the 30 some odd pages that exist in the updates. I'm happy to provide where I see there being a nexus, Hannah and I'll say CDCR. So Hannah and Secretary, I will say, if there is something that I see that CDSS is doing that it has a nexus with CDCR, I'm happy to provide those updates, not to publicly force you all into any sort of relationship, but to inform the greater work of the council. So happy to make that my executive officer updates. Councilmember.
Thank you. So I think so when I think about the community college system, we do so much of everything. So when I'm obviously providing updates, I'm very focused on housing, rapid rehousing program updates, right? So I think having so when we all agree on the vision and mission, but I think if we can get even more clear, granular to say 2024 to 2025, we want to focus on workforce development for this, right? Like specifically some specific issues. And I think that will facilitate the conversations. You know, I can speak for our system that we're more than happy to say, hey, we have these resources that we didn't even think about coming into this space, because my frame of mind is, you know, coming in with one preconceived notion, right? So if you can like guide that type of conversation, I think we'll have a very robust report and updates and connection that's organically generated in this conversation.
Yeah, I really appreciate that. That's been sort of my instruction for staff is as we're talking about the action plan, as we're providing updates, but specifically the action plan. So we understand, for example, CalVet's mission to be A, B, and C. These are the things that CalVet provides. But here are the nexuses to the remainder of the council that we think could amplify and further push CalVet's services and mission towards success. But recognizing, you know, these things have historically existed in silos. But so I think my mission, vision, and values was really as a reminder that Cal ICH is really here to serve each one of you to ensure that you are succeeding in ending and preventing homelessness for your respective populations, however we can do that. So I appreciate that.
So I just to piggyback off that, I guess my push is to kind of give some of that burden with the council. So we can start to make those connections. Because sometimes I talk to Cody says, can you, but that's very specific. Right. So my answers are yes and no and maybe, right? Like there's no additional kind of iteration beyond that.
Right.
So
but however, and I'm sorry, Hannah, but like CDSS happens to have this thing for, youth populations who are likely to exist in. CalICH is stretching itself to ensure that we're making those connections. I think it's going to be uncomfortable, if I'm being honest, with this body for a while, because we are in a very tough fiscal climate. And so we're not asking for additional resources. We're just asking for reimagination of what exists.
Hi, this is Elisa Becerra. I'm in for Director Tavares from Caltrans. Heard our name a lot, so I thought I should speak up. I think one thing that's really important for us and people don't really understand are where we are in this entire effort, but there's not a lot that we can offer as a transportation department. So we really need the assistance and the ability to know what's out there. We call ourselves influencers. Because all we can do is really try to leverage or influence assistance to people experiencing homelessness on the state right of way. So knowing what's out there and knowing, especially as we talk about tough economic times, it's time to get creative, right? I always equate it to like my home budget. When you're low on money, you got to figure out what can we do? What can we help? Who's got what? And I think that spirit of coming to the table with all of us saying, well, we have this, or we don't have this, but we have this, maybe we can help you. I think that spirit of let's get down to brass tacks and see what we've got and get going would be really helpful, especially for us. And by the way, we're available to make those connections. Definitely reach out.
I appreciate that. I will say we have council member departments who have, fiscal investments and who have populations that are desperate for, connection to those fiscal investments. CDE, I think, is a great example of that. I would say they're probably in the same situation as Caltrans, and that they're intersecting with these populations and are seeking connections to those resources. What's important is for this body to understand like the level of need and the type of need that exists. Councilmember Lewis.
I'm really encouraged by this discussion and excited. And I love the term organic, right? To be able to figure out how to foster or strengthen existing relationships. For me also, though, given the name of the council, Interagency Council on Homelessness, which is, again, I've said this multiple times, why I was excited to be a part of it. I'm hoping that possibly a couple of the objectives, on the new action plan are related to finally fully being able to lay out the clear picture of all the different interventions and ways that they interact or intersect or not across the state government that are offered, right? And obviously most of it is administered at a local level, but that still doesn't exist. And so in addition to just the organic process of fostering and helping to figure out where the connection points are, possibly or redundancy are, hopefully, I think we get to the point where we really can demonstrate this is what California is doing. We can understand redundancies. We can understand policy. Those that may have come up during listening sessions, like what are some of the conflicting policies, what are conflicting eligibility requirements, et cetera, and really create streamlining where possible, or at least reduce barriers and duplication of assessments, right, and all those kind of things. And so I think this is a good step one, but I'm hoping that the action plan can lead us to something that's more formal so that we can clearly understand all the different ways California is helping to prevent and end homelessness and improve across the state.
Sort of a thought that we had, because certainly the action plan is geared towards state departments. And so the target audience for the action plan are state departments. At the highest level of state government, here are the things that we're doing to prevent homelessness. More recently, and what can we do better? Here are the things that we would say that we would like to have that we think could better inform the system. There are two, just for the benefit of the council, I'm sure everyone's aware of this, but we do have two positions that are legislatively appointed. Councilmember Lewis very recently appointed Councilmember Kuchel. They don't oversee a state department. They don't oversee an area of the action plan. And so sort of a thought that we have is that we invite them to come to the listening sessions, to the planning sessions that we have with each one of your departments and agencies, so that they're well informed of the things that are available and the innovation that's possible. So more to come on that, but thank you for that, Councilmember Lewis. All right, I do think I'm at time. Right at time, Cody Ziegler, if I'm not mistaken. Wonderful. So with that, I'll turn it over to my Director of Statewide Policy, Cody Ziegler.
Great, thank you. Thanks, Megan, for facilitating that. You know, I didn't want everyone getting sick of me talking through the whole meeting again this time. So thank you all. Really good to be here. Good to see you all. Thanks for the engaging discussion. So I'm going to kick us off quickly for this agenda item. I'm really excited to introduce this, and then I'm going to introduce someone who's going to introduce someone who's going to introduce the LEAB. So just giving you a sense of where we're going. But one logistics note before I start. When you're speaking, please remember to use a mic because those online can't hear you unless you're using a mic. So just reminding midway through the meeting. But so this agenda item, we're going to get to hear from some of the members of our Lived Experience Advisory Board about the priorities they've developed as a group over the past few months. So you'll hear a little bit about the background of the creation of the LEAB. And before I turn it over to them, I just wanted to sort of set the stage and remind folks in the room sort of where the LEAB fits in our overall council environment. Also a note that members of the LEAB are joining virtually because they are all over the state. And so instead of having them come here in person necessarily and travel, they are visiting virtually. So you'll see them on the screen soon. So on the next slide, I sort of joke this is Councilmember Lewis's slide dedicated to Councilmember Lewis because she asked for a slide like this. I don't know if we did a good enough job, but this is our attempt at visualizing sort of the bevy of resources that the council has at its disposal, right? So we have the Interagency Council here, and then there are multiple groups that we have created over the past few years to provide either resources, guidance, advice to the council, to you all, as you're making decisions, creating recommendations, et cetera. So the advisory committee, as you know, it's made up of 30 experts on homelessness policy implementation and research from across the state. And we have our Lived Experience Advisory Board, which is comprised of 11 people with current or former lived experience of homelessness. And those two groups really are meant to provide guidance and recommendations, as I said, to inform your all's work and decision making, right? So they're going to come up with their priorities. They're going to come with recommendations. They're going to have ideas for how can we as a state better prevent and end homelessness. And then you all also, in a reciprocal manner, can go back and say, we have this question. We want you to look at this thing. We want recommendations on, you know, X, Y, or Z that we are struggling with as an interagency council. So that's sort of where the advisory committee and the LEAB fits in. And then we have the working groups. So the action plan calls out 5 interagency working groups. We have 2 currently up and running. And I just want to call out, Zach, your note earlier about sort of like identifying specific contract issues across different programs, right? So our state funding and programs working group that we have up and running is currently taking on an effort to literally go through all of the NOFAs that we all have in this group relating to housing and homelessness, identifying sort of common elements where they might differ, what we're asking that's in conflict or that's not exactly similar, right? Where we're duplicating data collection efforts so that we can provide those recommendations to this council, right? So that's a great example of the working groups are meant to move forward the priorities of the council in really specific ways. We actually have all 3 of the co-chairs of that working group here. I won't call them out right now, but that's one of the groups, right? Our other is our racial equity working group. And so that's sort of the role of those working groups. So I just wanted to reset sort of or remind folks where the LEAB fits in this environment before we hear from them. And I think, and the last note is, right, these dotted gray lines here, all the groups can work together as well to create recommendations in conjunction. So now I think I'm going to pass it, or Megan's going to introduce Courtney.
So as Courtney's making her way to the podium, I will just say very clearly that these bodies are available to the council, not just on your work for the council, but for your work to ending and preventing homelessness in California. So I'll use the LEAB as another example, although we know that there's unique needs for each department. There are, and Courtney will speak ad nauseum about how you can connect with the LEAB if you're not interested or capable of standing one up because of resources, Each one of these groups is available to support the work that each of your individual departments and agencies are doing to ending and preventing homelessness. So with that, Courtney Tacker, who is Cal ICH's Director of Local Initiatives.
All right, good afternoon, everyone. As Megan mentioned, hello, Courtney Tacker, Director of Local Initiatives. The Local Initiatives Division has the privilege of supporting the facilitation of Cal ICH's Lived Experience Advisory Board. We are very fortunate to have 5 of our members here today who are representing the LEAP as part of this presentation. So I just really want to start off by thanking our members who are taking time to be with us all today and provide their time and expertise for this presentation. The purpose, actually, if we could advance the next slide too. So the purpose of today's presentation is to introduce the council to the LEAP's current priority areas. We will start with providing some background on the purpose for selecting priority areas for the LEAP and how those will that will be presented today and how those were determined. I'm then going to turn it over to another member of the Local Initiatives Division, Lisa Avron, who serves as the Cal ICH LEAP liaison and is responsible for meeting facilitation, the LEAP request process, and the primary connection for our LEAP members. Lisa is going to facilitate introduction of the LEAP representatives who are here with us and will be presenting on those 4 priority areas. And then she will be facilitating discussion questions with the council members and our LEAP representatives following that presentation to discuss where there may be opportunities to work together on these priorities. Next slide, please. So over the past few months, the Cal ICH LEAP has participated in a survey and group discussions to identify and create a list of top priorities that will guide the work of the LEAP. The LEAP developed an expansive list of topics that was synthesized into a total of 9 overarching topic areas. The LEAP then determined and voted on the selection of 4 topic priorities at this time. The purpose of these priorities is to support in the following 3 areas. So first, to communicate pressing issues. The intent of these priorities is to highlight the most urgent homelessness issues to the council, working groups, homelessness system leaders, and the public. Secondly, to guide the LEAP in accepting external project requests that align with their priorities. At the close of this agenda item, we will also be announcing the formal launch of our LEAP request process so that the council and member departments can submit project requests to the LEAP for their input and feedback. The LEAP can then use this list to prioritize requests that align with their current focus. And last but not least, these priorities will support the LEAP in developing their own internal projects to work on. So with that, turning it over to the next slide, I'm going to introduce and turn over this presentation to Lisa Avron to introduce our LEAP members.
Hi. Hello, everyone. How are you? Thank you so much, Courtney, for that wonderful introduction. Again, my name is Lisa Avron, and for the past 6 months or so, I've had the pleasure of working as an SSM1 specialist here in our Local Initiatives Division for Cal ICH. More specifically, as was stated, I am the liaison for our Lived Experience Advisory Board. Before we go ahead and dive into those 4 priorities today that were established by the LEAB in May, I'd like to take a moment to allow the LEAB members to introduce themselves. So I'm going to go ahead and ask folks if they could, there you go, join us on video, and I'll start with Melanie.
Hello, council members and attendees. My name is Melanie Robledo, and I recently transitioned into a new role as Senior Program Manager, leading the National Reentry Housing Incubator at Impact Justice. This groundbreaking initiative will provide funding, targeted training, and technical assistance to selected community-based organizations and faith-based institutions all across the country seeking to implement or enhance housing programs. Locally in Los Angeles, I'm also thrilled to support a one-of-a-kind housing model that pairs homeowners, also referred to as hosts, with participants. Participants are individuals who are on their reentry journey after having spent 10 years or more in prison. It's a win-win. Hosts receive a significant stipend, and participants receive a safe and supportive environment to thrive. Both of these programs are innovative solutions to addressing the prison to homelessness pipeline. Outside of work, I'm grateful to have the title of full-time soccer mom.
Thank you so much, Melanie. Audrey?
Hello, my name is Audrey Pearson. I am a team lead case manager at Hopix in South LA here in Los Angeles, and I I'm on a street outreach team, leading a team in Compton in SPA 6. And my agenda is really to talk about prevention services today. So that all ties in with my history and the work that I'm doing with the league now. And I'm honored to be here. And I thank you for lending your ears today.
Thank you so much, Audrey. Carissa.
Hi, everybody. My name is Carissa Smith. I am from Clear Lake, which is a rural community in Lake County, California. I work as a community health coordinator at our transitional shelter called Hope Center. I am also a full-time student. I just graduated with 2 associate degrees, and I have been accepted to Cal Poly Humboldt. I'm pursuing a career in social work. My long-term goal is to become an LCSW. Let's see, why did I join the LEAB? I joined the LEAB because of my lived experience. My homelessness started at the age of 14. I am a childhood trauma survivor, and that process took me all the way into my adult years, which didn't end until I was about 30. I am formerly incarcerated. I've experienced human trafficking, addiction, homelessness, and I am passionate about helping other people overcome their barriers and giving people hope that other people can end their homelessness as well. I went from experiencing homelessness to being a homeowner, and that is something that I'm really proud of. Thank you for having me here.
Thank you so much, Carissa. And we will jump to Monique.
Hi, good afternoon, everyone. My name is Monique Guerra. I'm the Homeless Youth Coordinator with Riverside County's Continuum of Care under Housing and Workforce Solutions Department. It's important to note our department because under that department, we have 5 divisions. And so really thinking about the collaborative efforts between workforce, housing authority, and as the COC, we primarily distribute funding to subrecipients and agencies providing housing and homeless services across Riverside County. I also recently led our youth homelessness demonstration program grant. And so that has been a very long journey, but really in hopes of creating new housing. And so one of the topics I'll be talking about today is affordable and sustainable housing. And so really through the YHDP grant, we've been able to learn a lot about the needs of the youth in our community. I'm also someone with lived experience. I'm former foster youth, former homeless youth from LA County. And I have seen what it is to be counted during the youth point in time count and having led the youth point in time count in our county as well. And so really excited to be here with you all.
Thank you so much, Monique. And last but not least, Annalie.
Hi, my name is Annalie Trujillo, and I'm from the Paula Van Mission Indians. We are in Southern California. I'm the only tribal representative on the LEAD committee board, and there are 110 federally recognized tribes within the state of California. Historically, our tribes have been underrepresented, underserved, and not included in any of the state budgets until recently. We are experiencing housing deficiencies and housing, insecurities across the board for all of the tribes. My role is to represent the tribes in a meaningful way, to also bring a cultural aspect to it, and just kind of remind everybody that the tribes have been the first to be homeless by action of the state. So it's really important to have tribal representation across all of the boards within the state for housing and the other programs that use our population, our tribal population for any of these programs. Again, I wanted to say the tribes have been underserved for some of the programs. We recently are able to apply, say for tribal HAP, and that budget for tribes, the 110 federally recognized tribes, is at 20 million. So if all the tribes apply for this program, only $181,000 would be allocated to each tribe. Now, if you sit there and think, how can you serve your populations or your cities or your jurisdictions with that amount of money? It's kind of, there's no way we can do that. And since the tribes have been underserved, we're desperately in need of housing. We have the highest rates of homelessness, the highest rates of mental illness, the highest rates of everything across the board, but we're never included. So just to have a seat at the table and talk about our issues and advocate for housing is, for me, I'm representing our ancestors who once walked where your homes are, and it's really important and emotional for me to be here and just to talk about that and talk about the removal and the termination of our tribes. And now, just being included to help all of the tribes across the board for me is phenomenal because I'm that voice and now we're finally being heard. And I want to thank you for having me.
Thank you so much. And thank you all for joining us today and for introducing yourselves. We're all looking forward to hearing you share your expertise and your experiences with us today. Next slide, please. All right, so the first priority we'd like to discuss today involves working to end the criminalization of people experiencing homelessness. And on this topic, Carissa would like to speak.
Hi, everybody. I'm advocating to end the criminalization of people experiencing homelessness. It's a huge issue in my community. People that are experiencing homelessness are relocated over and over again. It's really traumatic. Last year, law enforcement came to my work and asked me to go to an encampment with them to offer resources. I should have asked. I didn't know. I didn't know that they were taking me on a sweep. It was really traumatic for me. They asked me to go offer resources, and it was really traumatic because there were no resources. The shelters were full, and it's just something that I never want to go through again. What this does is it breaks trust with helpers. People lose their documentation when they're relocated. They lose their important medication. They lose contact with their service providers. This creates more barriers and does not solve the issue of people experiencing homelessness. And shelters are not the solution for everyone. I'm advocating for safe encampments where people can have access to sanitation services and can participate in housing navigation, case management. When people are criminalized and cited for trespassing, this creates more barriers. People miss court dates, they end up with warrants, and this could be preventable if people were not relocated over and over again. Safe encampments are a priority in my area because shelter space is limited and shelters can be particularly challenging for people that have experienced trauma. It's also important in my area in rural Lake County because we have lost a lot of our housing due to fires and we have not rebuilt since 2015. Safe encampments people have a right to feel safe, and safe encampments can provide safety and make services accessible until housing is available. Thank you, everybody.
Thank you so much, Carissa. And it looks like our sixth member, Marjorie Beezer, has been able to join us today. Marjorie, are you present and would you like to speak up on this point?
Absolutely, and thank you so much for the intro, Lisa, and the space. The question that we're addressing, or the concept area where we're working to end criminalization of people experiencing homelessness, some of the key areas of consideration have to surround or revolve around the concept that encompasses things like making it a crime to sleep outdoors or in shared public spaces, such as parks, or even to be limited in your social skills, given challenges with your mental or emotional health. These are some of the key things that when we criminalize behavior that are physiological in nature, psychological in nature, that also presents in social contexts and other social settings, what we do is we criminalize being human. And that can prove challenging in and of itself. Not only is it not sustainable, but it is unreasonable. The goal should be to address underlying, mitigating, preventive factors that speaks to these types of issues so that we can actually get to the root of and dig out these issues and address them effectively, also sustainably. Said differently, it's taking something a person has limited or no control over, as I mentioned, their mental health, and then generalize it to a populace. When the population, the general population, feels uncomfortable or even unsafe, then the knee-jerk reaction tends to be making it illegal, right? To act in a manner that is consistent where others fail to act, those of us who are in the homeless space. And I am, for transparency purposes, I am currently homeless. I am literally sleeping in an abandoned car. So this is not esoteric for me. This is actually my current lived experience that I'm speaking through. And so when we take, again, as I said, those human qualities that may not be, quote unquote, normal, and criminalize them, again, we go right back to this notion of criminalizing our shared humanity. And then that, for me, for us, is one of the areas and one of the reasons why we strongly feel that criminalizing homelessness is not the way to go from a policy perspective. There's also the reason that because the number of persons who currently comprise our homeless population, there's somebody who, for any variety of reasons, find themselves in a situation where they are unhoused. You know, it's too expensive to live anymore in terms of being able to pay rent or pay a mortgage. You find yourself unhoused. Your wages are not keeping up with the cost of living. You've encountered some extraordinary medical emergency or situation that really taxes your resources. You find yourself homeless. You may have mental health challenges. There's a strong correlation between being unhoused and having mental health challenges. Are we going to criminalize the things or components that make us human? Those are some of the key areas that I would add to my colleagues' intervention with regard to why we feel that criminalizing experiencing homelessness is not a good policy perspective for a variety of reasons, especially including a lot of it comes out of this experience we call being human. Thank you.
Thank you. Thank you so much, Marjorie. Next slide, please. Our second priority we'd like to focus on, and that Audrey will be speaking on, is promoting a focus on prevention. Audrey, pass it to you.
Thank you very much. Yes, being a formerly unhoused individual, I have gone through a process just even recently trying to find prevention in services, not just for my clients, but just for myself. And what I found in my investigation is that there are not a lot of resources that we can tap in that's out here. As a person that is in the protective class with health conditions and so forth, you know, there are, I had the opportunity literally, as I was speaking with my therapist, explaining how my disposition has changed and I've gotten depressed more, and all of the things that was going on in my head. So being homeless for almost 7 years and then having to reface being homeless again is traumatizing within itself. And as a worker, you have all of the access, you know, being, you know, in a lead agency in South LA, you go to other organizations in your community that you can tap into, and they send you right back to the person that you can't go to. Because as an employee, I can't get services where I work, right? And so then I'm out, you know, so I have to find things out in the community. Well, from caseworker to caseworker to caseworker, they knew less about the resources that I needed and didn't have access to that. I don't have access to prevention funds. I can help you pay your utility bills, you know, so re-experiencing this trauma of becoming homeless again, that's something that ills your stomach. You know, it depressed me. So I had to get up and move, and I want to change things and I want to do things differently. And how can I do that? How can I make my pain and my purpose work for the advantages of other women of color and other individuals out here in the community who was laid off from work? You know, it wasn't a fault of anybody. She just laid off from work because you have an illness or what have you. I went to my doctor's office. They asked me, Are you experiencing homelessness? Are you experiencing these things or this things, any type of abuse? Usually I don't answer because I say, why am I answering where you're not going to be able to help me? And that's the attitude that a lot of us have, right? There's so much stigma attached to being homeless, and there's so much less resources to prevent you from being homeless. And that in itself is a crying shame. You know, when you restrict, make certain stipulations to say, okay, you must be homeless for a year before we can touch you or help you. You must have this situation in order for us to help you. Fleeing that situation, but what if I'm trying to just maintain and a health condition, you know, got in the way of me and work, and I'm one paycheck away as a homeless outreach worker, you know, we know how much we make. So how can I help me? And there was nothing out there to help me. I went to the Rent Relief website, and that's a website for landlords to then apply for their tenants, and then the tenants will go on and do their portion. Well, that closed as soon as I found the resource. A day or two later, that resource ended. So what happens when your landlord is a slumlord or someone who doesn't care if you become homeless again? You know, then you don't get help. And if there's no other resources, all the money is gone from COVID. So what do we have now that's in place to help? In July of 2023, homeless outreach teams served over 30,972 people, served 36,700 households, and enrolled 9,200 newly enrolled individuals, and permanently housed 1,174. Enrolled 9,200. Permanently housed 1,174. That's a large gap. And if we could have prevention funds to help us not have so many people, we have to work together on prevention services and stopping the bleeding. According to the World Population Review in 2024, California had the highest number of homelessness, estimated at 171,521 people. New York State has 74,178 individuals. That's a huge amount that we're taking in of individuals.
Audrey, I'm gonna go ahead and stop you there because we have to move on to our next priority, but I appreciate you so much. And I really appreciate you. Okay?
Okay.
All right. Thank you. Next slide, please. All right. And for our third topic, our third priority area of focus is advocating for more affordable, supportive, and sustainable permanent housing. And on this topic, Monique will speak first.
Hello, folks. Thank you to my fellow lead members who are amazing and have presented some great information. Just following up to like Audrey's point about promoting prevention, right? Is if we're not promoting prevention and preventative services, and if a lot of our systems have in place, right, in Riverside County, our coordinated entry system has in place that you do have to be literally homeless in order to receive quite a lot of the services that we offer. And so waiting for somebody to become homeless could be prevented if we had more funding for like diversion funding. And so if we're thinking about folks that I know Carissa was talking about, folks being able to afford housing. And so affordable and permanent housing is essential. I remember growing up, I experienced homelessness with my family, and it was because, right, if you made a little too much, or if one check or if 1 month was well, right, you didn't qualify for services, but we were never going to make it long enough to not need supportive services or social service programs. And so I remember my mom constantly trying to figure out how she was going to afford rent, was on a voucher for a really long time, and realized that she could do nothing else with life, because if she went and got a better job or went there was no opportunity, right? There was no connections to workforce. There was no way to get addictive services, right? And then get a good paying job after, and then be able to afford enough, but not enough to where you lose your voucher. And so always living within these means of I make too much or I make too little and it's not enough to live off. It is a problem that most of the folks experiencing homelessness see, right? And then there's also no incentive to why I would be able to afford, right, housing, childcare on my own, right, as single parents. And so realizing that her issues extended beyond just needing affordable housing. It was access to low barrier housing because she was someone who struggled with a background and addiction. And I realized, right, I have two siblings. And so having gone through college and figuring out, okay, I need to go to school, but I need to work, but not too much because I need to qualify for grants. I need to qualify for the funding that the school is giving me. I need to qualify for EBT, right? Proved very difficult. And then when I graduated, having got an accounting job, I realized I was still able to be eligible for a lot of items. I was actually looking for affordable housing and was on a wait list. And then as soon as I became permanent at my job, I was no longer able to gain access to affordable housing, but I still realized that even as a full-time working professional, I still needed access to wraparound services. And so along with like affordable housing, we need access to wraparound services, especially if we're moving folks in, right? Whether it's the rapid housing funding or any other sort of funding. And so what I really like about YHDP, the Youth Homelessness Administration Program grant, is it really pushes for eligible activities that create housing opportunities along with wraparound services. And so when we're looking at supportive and sustainable housing, they have to be options that are also viable for subpopulations. And so as a former foster youth, right, I wasn't able to qualify for anything anyway, because exiting a system of care early and then not going into extended services because I had emancipated because of the lack of education, right, also set me up for services that I was never going to qualify for. And seeing a lot of the youth population and having experienced youth homelessness, the need for supportive housing really does move you all the way up until 25. And so I know as a former foster youth, we see how beneficial it can be for folks to enter right into a transitional living program from 18 to 21 and then still be able to qualify for that transitional housing up until 25 is really necessary. But as of now, right, services don't go up to 25. And so a lot of the youth that I'm seeing don't qualify for services, make too much or make too little, and are always trying to live within these means. And so it's really advocating for the need for affordable housing.
Thank you so much, Monique.
Thank you,
I'm
Lisa.
so sorry.
No, you're good.
I'm moving us readily along. I really, really appreciate all of you. And we all appreciate you being here and sharing these stories and your experiences and expertise. But we have a limited time so we can engage in a fruitful discussion with the council here. So I'm going to go ahead and move us along to our last priority. Excuse me. No, we're not. We're going to stay. Can you please go back to slide the priority 3? Thank you. And Annalee is going to go ahead and share on advocating for more affordable permanent housing.
Again, I'm Annalee and from Paula. And for our tribe, we have 120 people on our waiting list. Our tribal population is 1,000 just for Paula alone. We have 32 tribes in our surrounding area, and we are pretty much in the heart of those tribes. Our office, what we did is we stepped up so we can help other tribes that weren't aware of programs that, you know, just barely became available to the tribes, and to help elevate those programs so tribes can apply for assistance to apply for housing, because housing is lacking on every level on Indian reservations. They said there's 110 federally Indian reservations, and as of now, nonprofits are able to access funding using tribal population, but tribes aren't able to access that same funding, and we don't get very much of it. So I come here today to talk about how housing is needed, affordable housing. Housing is not affordable, even on the reservation. We can't build a home for under, you know, maybe like $400,000. It's really hard to get contractors out here to perform the work. And, you know, once we do, we need to make sure that our houses are up to standard for our tribal members. We've had houses, our first set of houses that were brought out were called Linda Vista houses, and that was government houses that had to be put together. Other than that, the tribes had to do makeshift homes. And then finally, in the early 80s was our first grant that we got from HUD, and we were able to build some homes for our tribal members here. And that's how we got housing with the low income. That was for low income only. Now, mind you, we have members on the reservation that might not qualify under low income, but are still wanting to live on the reservation where their family is, where their culture is, where we have our cultural ceremonies, and don't want to live outside of the reservation. So we need to get access and resources here. The other thing I'm advocating for is supportive services. We want to house or talk about housing the homeless. What about keeping the homeless in a home, but we have to make sure that they're healthy as well. You can provide a house if you want to for somebody, or a room, or some type of living situation, but until you address the root cause and have those wraparound services, the issue is going to be still there. And we experience that daily. We have tribal members that are using drugs, substance abuse, and before there was no rehab or facility or wellness treatment, anything, those fancy words that were available to tribes, we weren't able to send our people to rehabs. It cost too much money. So what happened? They continued to use drugs. They continued to overdose. And I've seen my own family member, my brother passed away from a heroin overdose, and that's still continuing. And we're just seeing them younger and younger. So what we're trying to do is we're trying to capture the youth, and we have to be held accountable to all of our tribal people. So when you're talking to cities and counties, you don't have to look at somebody in the face and say, why we can't help you. We do that on the daily. Our people come in here. We have a relationship with every single one of our tribal members. And it's hard to explain why we don't have access to the same resources. And how can we get the access to the resources? I hear about all these wonderful programs, having access to vouchers, having access, to any type of assistance, wraparound services, or affordable housing. We don't have that opportunity. And if we do, it's very, very minimal. And the tribes, like I said, have been excluded from any type of assistance at the state level. And now that we're included, there's all sorts of barriers that we have to work through in order to get funding. So, I know that, people ask themselves, why do we have to help tribes? They have casinos. That's not the issue for all tribes. All tribes aren't gaming, and all gaming tribes aren't rich. We're still dealing with issues that we've, from our ancestors, from dilapidated housing to homelessness, to not having enough housing, to not having services. And I don't know how many of you have heard of MMIP. That's missing and murdered Indigenous people. We have the highest rate of our people getting trafficked, getting murdered, that their cases were never solved, never looked into, never investigated, just written off like, oh, it was just a death. Those are our people. And that ties into housing as well. We need safe, affordable housing for our people. Thank you.
Thank you so much, Annalee. And we only have very limited time here, but I'm going to go ahead and ask for the next slide, please, and pass it over to Melanie, who will be speaking on centering lived experience and expertise in decision making.
Hi, everyone. So I want to raise the issue about centering lived experience, expertise in decision making. It means creating an opportunity for the constituents that the policy aims to serve to be involved in the process of developing needed creative solutions. This engagement allows for mutual feedback and a platform for those who have been impacted by the system to deliver meaningful strategies grounded in real-time application. It is also a unique opportunity for individuals who have had experience with homelessness to expand on situations that are often not reflected in data points. This shift will change the way we see things and how we can move forward together. For example, there's a common misunderstanding about addiction and homelessness. From personal experience, I can tell you that there is a high level of vigilance required to attempt to minimize the sexual violence endured with no safe, stable, and trusted place to go. Some may believe that addiction is an excuse, a choice, but I saw it as grasping at any hope of survival. In a separate example, there is a need to raise the issue of systems disconnected between systems. In short, there's a recorded incident when I was booked for loitering in public, taken to court in a straitjacket and seen as a danger to myself, but released on my own recognizance. Although I'm now comfortable sharing this part of my story, if someone had asked me during my struggle or even a year ago if I had ever experienced physical or sexual violence while homeless, I would have said no. Working in a space as a peer specialist, I have witnessed individuals form personal connections with those who have lived through similar situations. This connection builds a strong foundation of trust, allowing us to not only ask questions for data collection, but to engage in meaningful conversations that lead to solutions. Thank you.
Thank you so much. We're going to go ahead and move into the discussion portion to make sure that we have enough time to talk with each other. And thank you everyone for sharing your expertise, your insights, your experiences. And for the next 15 minutes or so, we'd like to hold an open discussion to allow the council members and the lead members to speak to each other about the issues presented here today and to create some connections and an open channel of communication. I'm going to first ask the council a question, and after they respond, I'll go ahead and turn that question back onto the lead so that we can get to know each other a bit better. I'm going to ask before you speak, if you could introduce yourself, both lead members and council members. That would be super helpful for everyone speaking today. So our first question today, directed towards the council, is where does the council see opportunities to work with the lead on these priorities?
Well, maybe I'll get us started. Tamika Moss, Secretary of BCSH and Co-Chair of the Council. First of all, thank you all so much for sharing both your stories and your perspective on these priority areas. I share them. I think that they are critically important in not just surfacing that they exist, but figuring out how we create policies that really disrupt some of the challenges that you all raised. I see an opportunity for us to really get specific about how these priority areas show up in our action plan. To me, this is our chance. It's kind of prime time for us to think about what exactly either models in communities or organizations that you all work with, examples of programs or policies that have been successful or demonstrate a commitment to what you all are describing, and then for us to really integrate those into our action plan and then see how we do. I think we need real-time progress reports, frankly, on how it is we're doing to address some of these issues in the community. So that was something that came to mind as you all were describing the priority areas.
Thank you to Secretary Moss. I'll just say right behind you, sorry to scare you. Yeah, on the side. Hi, how are you? Just to say, would encourage all of us to think about, I mean, we have the collective statewide action plan to prevent end homelessness for the council. But we have multiple agencies and departments reflected here who have their own action plans, not specific to ending and preventing homelessness, who may need or should think about the inclusion of persons with lived experience. And so again, as another plug for those of you without your own individual leads, like please look to that of the work of the council to help inform the individual work. You've heard the vast experience that we have from our lead members represented today. I think they touch almost every single department represented on the council. So would encourage you to please think about these folks to inform your individual action plans or strategic action guides. Councilmember Lewis.
Veronica Lewis, community member and from Homelessness. Thank you so much to all of the presenters from the Lived Experience Advisory Board. I think I want to go a little bit further in terms of thinking about how this translates to the action plan, because there's lots of versions of leaves, that the placement of the input from the people on the lead is, I think, what's really in question here. And so sometimes after initiatives have been developed, vetted, it's like, what do you think about that? Is not necessarily always the most meaningful way to incorporate.
Like, what do you think about what we did versus how do we do what we should do?
So I think that one of the things that we can think about is how to, I know some of you have heard me say matrix a lot of times for a lot of different things, but the levels of engagement, right? And thinking about how ultimately to get to a point where policies, practices, initiatives, resource allocation, et cetera, are truly informed, truly meaning, again, there may have to be some significant transformations that are allowable within the constraints of whatever the funding stream is, but really having the voices be at the beginning of the process, not at the end, and at the center of the process where appropriate and feasible, right? And I think that because we could check a box all we want and say, we asked them what they thought, they said but the likelihood of really making shifts because of all the investment of time is unlikely in most of the cases. So I really hope that our action plan can go beyond just have a lived experience, but how are you going to incorporate their input into actually making core decisions?
Yeah, I appreciate that. Thank you, Councilmember Lewis. I know Secretary Galley has his microphone on. I will just say for myself and for my general counsel for Cal ICH, both of us have lived experience and have experience, like significant experience in multiple systems of care. It's very apparent to us that we need to be very clear with our persons on our leave, our multiple leaves, who are offering us their time to say, and how do we intend on incorporating your lived experience? This is not just like a checking the box for us, especially for those of us who have direct experience. We want to ensure that it's meaningful, it's actionable. We've heard both of our co-chairs commit to that. So I appreciate that. Secretary.
All right, and this will be our last comment from the council before we turn it over to Leap. Thank you so much.
Oh, I don't want to be the last one. If somebody else has a comment, I want to make sure that I'll say this and then quickly see if there's others. Just building on what you said, Councilmember Lewis, in prep for this conversation, we were talking about exactly this. How do we make sure we don't tokenize the input of the LEAB? And I just want our LEAB members and I'll add my gratitude and thanks for your just sort of commitment to this council, helping bring us along a bit. But the difference between inclusion and belonging really is a little bit about this. So how do we make sure that it's not just reflected in the action plan, but that we're really candid? Hey, this is the priority that we're going to see in the action plan, and we're going to ask you how we're doing, ask you what success looks like, not come up with the convenient measures that we think we can hit or understand. And I mean, I gravitate to one that they started with, the work to end the criminalization. That we haven't talked a whole lot about that here. I don't know that we have been candid about what that would look like. I'm not even sure that we really heard today what that actually deep down looks like. I mean, how do we make sure we have this iterative exchange and we not just have it show up in the words of the action plan, but that it's sort of at the fabric of what we're trying to do? Because I think if we're committed to saying, hey, that lived experience matters, it's going to not just inform policy, but drive it in a way. It's going to take that kind of commitment. And we were talking about that, not struggling quite yet, but talking about that in the planning of this conversation. And I think that's got to show up if we're going to be serious about this. So I think it's great to have 4 or 5, but we also have to be candid. We think we can hit 2 of these really hard in the action plan. Here's why, and decide what that is. But have that be a really candid conversation with folks so that we can deliver. And I think that's speaking on behalf of Secretary Moss. I think that's what we're committed to figuring out with all of you.
Secretary Galley, I will just say with a few minutes, and perhaps we can figure this out in formalities later. But what I'm hearing is that the council would perhaps like to take action on some of the areas from the LEAB that they've identified as their priorities. How can the council identify areas within our respective purview to ensure that we uplift those priorities? So, Secretary Sin? Yep.
Kind of giving my input here. Hi, Lindsay Sin, Secretary for the California Department of Veterans Affairs. So as we're talking about developing our action plans, I would just throw it out there. I think that all of our goals and the action plans we're looking at should actually center around these 4 goals that the LEAB is putting forward. To me, this is actually the core of of how we should be informed. So rather than thinking about how our agencies are creating intersectionality, if we have to put that in our action plans, then maybe we're just not doing our jobs as members of this council or leaders of our various agencies and departments and instead focus on a completely lived experience model, which is taking the LEAP suggestions and embedding that into the action plan first and foremost, if not building our entire action plan around those types of suggestions.
Yeah, thank you, Secretary. And what I will say is that I've heard a recommendation from a council member. We will certainly put that on the agenda for the next council meeting for consideration. So thank you for that. Lisa?
Thank you so much. All right, and now I'm going to go ahead and turn that question right back over to the LEAB and ask our LEAB members present here today, where does the LEAB see opportunity to work with the council on these priorities?
I can answer on my part, if that's okay.
Go ahead.
As being from a tribe, we've never really had, not seen a seat at the table, but our voices have never been heard. And our needs have never been asked, nor our housing or any of our issues have never been prioritized. Just having a tribal representative for each and every one of the meetings that have to do with housing or have to do with anything that involves tribes, it's really important to have tribal representative at the table because nobody can speak for us except for us. And nobody, can understand our needs unless you actually dive into it and learn about tribes. So if you don't have any idea about tribes or reservations, I humbly ask that you look into it, you look into the history, because then you'll understand where we're coming from on our side of it and how we desperately need the resources that are available to other populations that aren't readily available to our tribal members. Thank you.
Thank you so much, Annalee.
Hi, good afternoon, Marjorie B. And I start to introduce myself when I came excitedly co-chair of the RLE.
Hey, Marjorie, you might,
as I said,
we're having a little bit of trouble hearing you. We might be able to hear you better if you turn off your video.
Okay, I could do that.
Which is unfortunate, but
how's that? Oh, it's okay.
We can hear
you guys got to see me already. Yes. What I was saying is Marjorie Bees are co-chair of our Cali. But I'm also earlier, I'm with current lived experience sleeping in a car at my age. I'm a veteran, honorably discharged, sleeping in a car. I'm a woman with 30 plus years expertise at the highest levels of government, the lowest levels, and in between. The question was asked, what's my vision of how we as LEAB can assist the council with its work? I agree with Annalee. We need to be at the table, not once the decisions are made, but to help to craft the decisions, to frame the conversation. It needs to be an intersectional, multidisciplinary approach. Why? Because that's the nature of life. We make policy for people, not people for policies. And so when we take a person-centered approach to how we make policy, that's going to be important. The other way that I think that the LEAB can be, if you will, a partner in this important work is we can be your eyes and ears. It's important to keep touching bases, if you will, with the persons who are experiencing the pain points. So yes, we do things like SSF just got done doing the point in time count, but that's a point in time that's static. Every day our world changes. Every single day, the different dynamics, whether it's climatic, whether it's food insecurity, mental, emotional health and wellness, housing, name it, it changes each day. So I think it would be really good if we could serve in that role where we keep giving you and pouring in real-time data, information that's helpful in terms of being, if you will, very strategic about how we policy make. Those would be my suggestions.
Audrey here, Pearson from Habits. As well, I'll piggyback on what Margie is saying. how we can work together is we can work together to break the cycle of homelessness, be it prevention services, be it, we working together at the table, having a voice, and knowing what's going on. So breaking the cycle of homelessness, that's key. And that's all of our goals.
Excellent. And I saw there was one more hand up. Carissa?
Yes, one way I could see that we work together is continuing to have these conversations and including lived experience, but also including our lived experience board is all across the state. We all represent different areas. The area that I represent is a rural community, and our housing here might be different than what it is as in a city. And I'm going to give you an example of this. Sometimes the services and the grants that we get just aren't accessible and don't work in a rural area. Lake County was awarded 40 emergency housing vouchers through HUD. We only used about half of them before we had to give them back so they could be utilized in other communities. The reason why we weren't able to use them as quickly enough is because we don't have the housing here that passes the HUD criteria and the guidelines. Not to say that there aren't safe homes here, but we've lost a lot of our housing here in Lake County due to fire. And the majority of our housing here isn't stick built. It's not on foundation. The majority of the housing here is modular homes and trailers. That is the majority. I'm going to give you an example. I worked with a woman who had an emergency housing voucher. This is a little bit of her story. She was Native American and African American. She did not trust systems. She did not trust government, and rightfully so. She was awarded this voucher for her children. She eventually found a beautiful place that she loved within all the guidelines for this voucher, the rent reasonableness, HUD, all of the things that would pass. It was a 3-bedroom, and what this mother saw was a backyard, was a big yard that was fenced in where her son could ride his tricycle, a kitchen where she could cook, a place for her family and her to be together. And guess what happened? It didn't pass the HUD criteria because it didn't have the tie downs for the trailer. After that, this mom lost trust in systems. The vouchers are only for 120 days. It expired. And now where is this mom with her children? This mom really is truly living in a place that is not for human habitation now. She's living in a shed with no running water. Her children are separated with family members, and she gets to spend time with them at the beginning of each month in a motel until her money runs out. This place, if there was less barriers, this modular home could have been a home for her and her children, and they could have been together. So I think hearing these real stories from boots on the ground workers, people with lived experience, is an opportunity to work together, because not one size fits all works for people. We need to build the boxes with supportive services around people, as we've heard before, and not put people in these boxes that they cannot access.
Thank you so much, Carissa. And with that, we're going to go ahead and close the discussion portion. We could talk all afternoon, frankly. I think we would all have a lot to say, and I love hearing from all of you, as you know. And I really enjoyed hearing from our council too. So thank you again. Thanks everyone for listening and engaging. As Courtney mentioned earlier, Cal ICH is, I want to close with an announcement. Cal ICH is pleased to announce the formal launch of the Cal ICH LEAB request process. So this process will be managed by our Cal ICH LEAB liaison, myself. Council members will receive formal communication later this month, inclusive of resources and materials for submitting requests to the LEAB. As a reminder, the LEAB reserves discretion for accepting requests and will consider them as they are submitted, and are looking forward to working on those requests that focus on these priority areas. We look forward to your future requests and to partnering with you, and thank you. And I will go ahead and turn it back over to Cody.
And by Cody, Lisa means Megan. So thank you, Lisa. Thank you, members of our LEAB. I just want to acknowledge that each of these persons has a full-time job, some of whom are actively experiencing homelessness, but make time and commitment to being here with us today. So just want to also say with that our rural county representatives that we have on the LEAB, we're fully aware, Cal ICH is fully aware, not just for those rural communities, but for those who are actively experiencing homelessness. We are identifying avenues for solutions for persons on our leave and for our multiple leaves, whether that's through CDA, CDPH, CDSS, for persons who are actively experiencing homelessness, who are committed to giving their time to the state to better inform our processes, not to put them ahead necessarily of a coordinated entry system, but to ensure that they're connected to the persons who are best suited to resolve their homelessness. So with all of that said, I will thank the LEAB again for their time and commitment. Encourage for those departments and agencies who don't have their independent leaves. I would also discourage departments and agencies who don't have a leave. Please access that the services that exist through your council. So with that, I'll turn it over to Cody Zeker.
Great, and I won't turn it back over to you again.
I appreciate that.
Just kidding. No, just want to say again, thank you to all of the LEAB members for coming to present. I'm seeing them in the chat, thanking council members for having them and for listening and for the discussion. And I just want to say that, you know, we know that is not a lot of time in these meetings, and I'm sure we could talk for an entire council meeting just back and forth with these LEAB members. But I also want to, and so we will make time in the future to do more of this, of course, but I also want to thank them. We've been meeting with them at least once a month, if not more, on our action plan. So they have been engaging with us on the action plan, on the structure, on the tools, on the goals, like was mentioned, right? So they are definitely engaged in that process as well. And we are going to continue to engage them in that to make sure that, you know, their priorities and their work is reflected and, you know, and shared across this council. So just big thanks again to those folks. I also wanted to make sure we didn't cut off discussion. I know there's never enough time, as I said. So I am going to turn the speed up on my presentation a little bit here so that we can get to everything in this agenda item that we want to. So we are coming back to everyone's favorite perennial agenda item, which is our action plan. So you've heard now what CalICH as an entity, our mission, vision, and values, right? We've talked to the LEAB, one of our big resources and areas of recommendation and guidance, right? And now we're thinking about the action plan. And I think we've talked to most of you about where we are in that process so far. So we can go to the next slide. And really the time that we are in our timeline is we have talked a lot as a council about sort of high level structure, goals, what's this plan going to look like? How are we organizing things? And now we're really getting into the more focused conversation, sort of the nitty gritty of what is each council member, department, and agency going to commit to in the plan, going to add to the plan, right? To answer this call for boldness that you all talked about at the last meeting. I feel like boldness was like the word of the meeting in March. And so how are we all responding to that call and really trying to identify what we can do individually and then also in partnership in order to move our work forward. And so what we wanted to do was before, or as we're sort of getting into more specific discussions with you all about what work you're going to include in the plan, we wanted to take a step back because we've been doing a lot of public input and we've been getting a lot of feedback from many different communities about the action plan and about the work of the state as it relates to preventing and ending homelessness. So we wanted to sort of step back, share a summary of that feedback so that we all have that sort of at our side as we're looking to, okay, what can I do? What activities am I going to include in the plan, right? How can we take what we've been hearing from the LEAB and from other groups and really have that with us? So as we're making decisions, we can find ways to incorporate that feedback into our work. So that is what we're going to do today. We can go to the next slide. So just a quick overview. Between about February and May of this year, CalICH staff have done about 20 or so listening sessions with over 200 participants in them. These have included conference presentations, meetings with partner groups that council members wanted us to speak to, ongoing CalICH advisory committee and LEAB meetings, as I said. And as you all remember, we sort of put out a call to you to sort of connect us with your consumer groups or advocacy groups or whoever it might be to get feedback on the work of your departments and agencies. And just a shout out to the community colleges. We spoke at a conference that you all hosted. CDE, we're talking to the HETAX, right? CDPH, we've talked to multiple groups within CDPH, including your LEAB, which their feedback was really appreciated. DSS and DOR, Department of Rehabilitation, we have like 7 different plans to talk to different groups within DOR. So thanks to you all for that. And so this is the type of feedback that we're hearing, right? We've also presented at conferences like NAEH and other places where there are Cal-ICH stakeholders who have thoughts about this work. So we've gotten a lot of input, as you can imagine. We are trying to sort of consolidate that and summarize it in a way that is digestible for you all. And we also, in addition to this, have been doing formal tribal consultation. So between, oh gosh, I had the dates here somewhere, but I'm now forgetting. But I think between February and March of this year, we opened formal tribal consultation on the action plan. We did 3 in-person meetings in different areas of the state, as well as virtual meetings. And so I am going to present on sort of the public partner feedback that we've gotten. I'm going to go through that relatively quickly. You all have it as a summary in your meeting packets. And then I'm going to hand it over to Vivila, who is our tribal liaison, who's going to spend more time going over the tribal input because we haven't gotten a chance to hear a lot about that. And so that will continue sort of the discussion from some of the lead members about the inclusion of tribes in the work. So more to come on that. So I'm going to start on the next slide. And basically what we did, and this is not going to sound like a summary, but it is, we summarized all the feedback into 9 different themes. So 9 is a lot, but we're trying to sort of identify general areas of feedback. So I'm just going to highlight like 1 or 2 bullets within each of these themes. It's again in your meeting packets. You can read through all of them more carefully as time goes on, and we'll bring them up with you in our individual conversations. But the first theme that we've identified in the feedback, right, is folks wanting us to have a consistent focus on addressing racial disparities and homelessness within state programs, including a focus on the specific needs of tribal communities. So I'm not going to speak to that a ton, the tribal communities part, because Vivila is going to. But one example of an idea in that theme was, right, like including actionable tools within the action plan to really like analyze the effectiveness of equity within programs. So not just saying we want equity, but like give us tools that we can each use or that the state can use, right, to understand the equity impacts of its programs. So we can go to the next slide. I said I'm gonna go through these quick. The second theme was really urgently increasing permanent housing supply in order to provide pathways out of homelessness. One of the ideas generated there was removing barriers to rapidly deploying funding for the development of new housing. You can go to the next slide. The next theme was ongoing flexible resources to be able to support a range of program models that meet the variety of needs of people experiencing homelessness. So using HAP as a model for program flexibility is something we heard, and allocating funding for historically unfunded work such as HMIS licenses and data entry training, right? The things that we don't necessarily always target funding at the state level. The next theme is around significant and meaningful inclusion of people with lived experience in state level decision-making. We heard about that in the last presentation as well. And an idea that we are highlighting is just like requiring or somehow incentivizing the inclusion of people with lived experience in program design within funding applications, right? So where we have an ability to say, here's what we are hoping to do, here's what we want to do, right? How can we incentivize that work? The next theme is around streamlining requirements and processes to help address the administrative challenges communities are facing, right? Keeping funding applications and reports consistent across multiple years is something that we've heard a lot about. Like the changing of requirements can be really difficult for local communities. Establishing a uniform HMIS data system or baseline system requirements across all counties. So making data entry more standard in that way. And thank you to Josh for doing the slides in the background as I run through these. The next theme is investing in the skills, wages, and capacity of the workforce within homelessness response and housing programs. And an idea here is to require harm reduction and trauma-informed care training for staff and measure the utilization of those practices, because we know those are crucial in the Housing First model. The next theme is around guidance and support to align housing strategies with health and behavioral health strategies to reach vulnerable populations and increase impact. That's something we talk about as a council a lot. One idea here was increasing communication between health, behavioral health, and social service programs to help decrease barriers to access. I know there are many people on this council thinking actively about how to do that right now. So that's definitely in line with some of the feedback we've been hearing. And I think if I'm counting right, this is the last theme. Preventing homelessness among people re-entering from communities. So from hospitals, jails, prisons, and other institutional settings, right? So where the state is actually actively working with people in institutions, how do we prevent them from exiting into homelessness? And one idea was ensuring service and healthcare access of the above populations. Oh, there's one more. I lied. See, almost done. The last is the interest in the state engaging in expanded communications and educational efforts around support effective solutions in local communities. So that's something we heard before, was like, how are we communicating solutions and how are we communicating progress that we're making? Another idea in the feedback, right, that I want to end on here, because I thought it was really helpful to think about, was how are we communicating the causes of homelessness and the responsibility for preventing homelessness clearly and accurately? Someone in one of our feedback sessions said people don't blame firefighters for the fires that they put out. And I think a lot of the people here would relate to that, right? Like, how are we messaging the work that we are doing and that we are actually the solutions that we are moving towards? So just wanted to put that out there. And that was the last of my section of input. I know that was very quick, but I want to give Avila some time to talk. So just want to make sure, Avila, you're here. Avila's joining us online and can unmute. Will you test so we can make sure we hear you?
Test.
Perfect. Great. And I'm going to pass it to Megan to introduce you.
Thank you, Avila. Just a second. So just as a reminder for folks who've been here for some time, in 2019, Governor Gavin Newsom recognized that the state historically sanctioned over a century of depredations and prejudicial practices and policies against California Native Americans. He then apologized and took action to work with California natives in respectful ways that elevated their needs and their voices. Through the Governor's Truth and Healing Council, they are further working to correct the historical record so that Californians are aware of the state atrocities against Native Americans. This understanding of community truths is a critical first step in working with California tribes and urban Native American communities. The state has had a role in the poor outcomes of California Native American communities, including homelessness. CalICH solicited formal and informal tribal consultation in February and in March of 2024. We had a representative who spoke from Lake County. My team and I were up there, certainly hearing from folks up north about their experiences with tribal home key, with HAP, etc. So just want to highlight, so we did 3 listening sessions up north, central, which is what we're considering to be the Sacramento Valley, and down south. And so we had Paula Band of Mission Indians who represented and hosted us for that listening session, one of which is a lead member as well. So just want to acknowledge those represented folks on our respective bodies and boards. So CalICH's tribal liaison will be delivering the truths and recommendations uncensored for your consideration. So the things that our tribal liaison, Avila Blossoming Bear, will be presenting to you are representative of the exact words, recommendations, and feelings of our tribal communities who participated in our listening sessions. So with that, I'll turn it over to you, Avila.
Thank you. Thank you. And it is important and respectful to my elders that I introduce myself in a proper way. So I'll pause to do that quickly. You heard my name, Avila Blossoming Bear. My people are from the Choctaw Nation, but I grew up here in California amongst California's diverse tribes and other diverse communities. And it's a pleasure to be with you today. I'm also an individual with lived experience of homelessness. So today I'll be providing a high-level discussion of input received, and I would like to flag for tribal partners who may be attending this meeting today. You may not hear everything word for word that was shared. However, please be assured that we are delivering every word that was shared to every tribal liaison in all of our member agencies. and the Governor's Office of Tribal Affairs, but this will be more of a high-level description. The meaningful incorporation, oh, we're still on the last slide. Can I tell you when to change slides? Thank you. The meaningful incorporation of tribal feedback into programs and policies that impact tribal communities is uplifted in executive orders and reflected in department and agency tribal consultation policies. The incorporation of the needs and voices of tribal communities further ensures that program and policy interventions designed to meet the needs of tribal communities are meaningful, culturally appropriate, and effective. Okay, next slide, please. So our tribal consultation included inviting formal government-to-government tribal consultations, in addition to co-hosting 3 regional hybrid listening sessions with tribal communities in partnership with tribes and tribally designated housing entities. And a survey was available for completion if preferred. Tribal leaders and representatives who attended listening sessions received a presentation on the action plan to prevent and address homelessness, an explanation of the council's role in the coordination of the response to homelessness, and were also asked, how can Cal ICH uplift the needs, voices, and best practices of tribal communities? Next slide, please. Thank you. Tribal communities are in crisis. The status quo only perpetuates this. Purposeful and bold action that is different than current approaches is imperative. California tribes have the highest disparities of homelessness, with homelessness rates of up to 50% of their population in some communities. They are far more under-resourced and have more barriers than local communities and continuums of care. However, they do not have a seat at our table to effectively participate in meaningful solutions that serve their communities, nor adequate accessible funding. Next slide, please. Excuse me. Oh, and I'll just pause. There's one point from the last slide. I apologize. I moved too fast, but that's okay. We can stay on this slide. Oh, okay. All good. Thank you. There's a sense of being disheartened regarding the lack of California tribal representation on the council. This lack of inclusion is felt as further disenfranchisement and disregard for California's tribes. Okay, thank you. Now we're good for the next one. California tribes are not BIPOC. They are sovereign nations. Addressing BIPOC needs does not equate with working with, nor addressing the needs of California tribes. Tribal communities and leaders would like the council to regularly address tribal-specific issues. Both federally recognized tribes and tribes who have not yet received federal recognition should be included in the action plan and homelessness efforts. Next slide, please. State, local governments, and others lack an accurate understanding of the real circumstances of tribal communities. Decision makers, staff, and others involved in homelessness solutions require, excuse me, culturally responsive, tribal-led education that includes critical history, facts about current needs and circumstances, what homelessness looks like in tribal communities, how to have respectful and effective government-to-government relationships with tribes, tribal sovereignty, and the connection between missing, murdered Indigenous peoples, suicide, substance use disorders, poverty, intergenerational trauma, and homelessness. Next slide, please. Tribal liaisons should be placed in the executive office of their department or agency, where they're best able to ensure strategies that meet the needs of tribes are elevated and coordinated at department-wide, as opposed to silos within departments. A request was made for my position to oversee a team of tribal liaisons at Cal ICH to support tribes regionally. Tribal engagement strategies and relationship building efforts require improvement. Cal ICH's strategies implemented in the Tribal Hat program were elevated as best practices. The California Department of Social Services meetings with tribal leaders were also highlighted. Tribal communities face racism, businesses that will not work with them, and organizations that increase their prices when working with tribes. Tribal leaders and their families face death threats when progressing homelessness solutions that place homeless Native Americans in the public's view. And community members face intimidation and threats of violence. Finally, the upliftment of tribally identified best practices, requirements for tribal inclusion in local efforts, and enforcement of these where possible is necessary to support local communities, state departments, and others to be more successful in their efforts. Next slide, please. Tribal leaders and representatives requested a regular forum to engage Cal ICH and the state to inform solutions that meet the needs of their communities, regardless of whether Cal ICH has access to funding to compensate for time and travel. State tribal liaisons, state departments, and others require better coordination within their departments and amongst each other. State departments and agencies should ensure that they are all applying the same culturally appropriate government-to-government strategies in tribal engagement and program and policy development and implementation. Communications must be culturally responsive rather than use standard state language, including in program and all documents. Tribes have limited capacity to engage numerous state representatives and opportunities. This requires the state to avoid duplication of approaches and to be better coordinated. Next slide, please. Tribes are in need of increased capacity, infrastructure, and permanent housing. However, the majority of state funding options were not designed for tribes, are not culturally responsive to tribes, and do not take into account their unique socioeconomic, legal, nor sovereign status. Tribal HAP at Cal ICH was noted as the most accessible best practice program. However, tribal leaders expressed that it was far underfunded with a 2% set aside of what other communities received. Excuse me. Tribal funding sources and state ways of working with tribal programs and policies require decolonization, greater understanding, a focus on relationship, a more human touch, and the elimination of practices that further disenfranchise tribal communities. And I'll highlight just a couple of examples that were discussed in our sessions. Excuse me, apologies for this ongoing cough. Funding often comes with a requirement to utilize evidence-based practices. These practices are typically not researched within nor in partnership with tribal communities, which are differently situated than dominant society and have a different culture. Tribes have had their own evidence-based practices within their communities for thousands of years. However, their expertise has largely been excluded from the development of our evidence-based practices. Requirements such as these require culturally appropriate adaptations, and that's from the point of the start of the program, not requiring tribes to deal with endless negotiations and requests for waivers in order to get culturally appropriate adaptations. Another example, a funding source that competitively scored tribes and others on their housing development experience. The majority of tribes will have limited, if any, housing development experience, as they have not had access to resources required for housing developments. Requirements such as these perpetuate a lack of access to funding and demonstrate the state's lack of understanding and partnership with tribal communities. Next slide, please. me. The current systems and data collection methods used to collect and analyze homelessness data do not adequately include California's 110 federally recognized tribes, nor the over 80 tribes seeking recognition. Data solutions must begin with meaningful engagement of tribes and be co-created. Tribes are rarely included in the point-in-time count, nor are they accurately captured in HMIS for various reasons. When they are included, there are consistent errors that require tribal inclusion and partnership to resolve. Data interpretation must be culturally appropriate, whereas it is meaningless and can be harmful. California tribes are often denied funding opportunities and a seat at the table due to their low numbers in comparison to other populations in the state. These low numbers are due to the government's actions, such as genocide, policy decisions that have harmed the community for over a century, and the ongoing impacts of these that are still felt very severely in tribal communities. Next slide, please. Preventing and ending homelessness in California includes preventing and ending homelessness in California tribal and urban Native American communities. However, they have felt like they are an afterthought to our efforts. We have been told by tribal leaders and community members throughout the state that what we are doing is not enough. Tribal communities are in crisis. Tribal leaders and representatives would like a seat at the table to co-create solutions in alignment with our executive orders on tribal consultation and our tribal consultation policies. Excuse me, and I'll just pause quickly to share. At Cal ICH, we're using tribal input to guide our work ahead, doing what is within our purview to uplift tribal needs, voices, and best practices. We are soliciting formal tribal consultation regarding a forum for tribal leaders and representatives in Cal ICH to come together in convenings to share information and co-create solutions. We have already begun amplifying best practices and correcting myths about California tribes in our newsletter and are looking into other opportunities to educate and elevate tribally designated best practices, including via guidance documents and training opportunities. We are also exploring what improved coordination with all member agencies' tribal liaisons might look like and the best way to facilitate this. We are also prepared to support member agencies as they consider and implement the needs, voices, and best practices from tribal communities. Next slide, please. So I wanted to pause and express my gratitude to all of the tribal leaders and community members who entrusted us with this information, to the tribes and tribally designated housing entity that co-hosted our listening sessions, to the California Native American artists who offered their work for this presentation. And I also want to thank the council for taking the time to consider and process this community feedback. Thank you. And with that, I'll turn it over to Cody.
And by Cody, you mean Megan. Thank you, Avila. But I just want to
Megan,
acknowledge.
yes.
Yeah,
Okay.
thank you. First and foremost, to our fantastic tribal liaison, Vivila Blossoming Bear. We're very, very fortunate to have you. Your advocacy and the tremendous relationships that you've been able to forge with our Native communities. And so, but a special thanks to Northern Circle Indian Housing Authority, the Palabana Mission Indians, and the Wilton Rancheria for hosting our listening sessions. We were very fortunate to have your space, your time, your energy, and your input, all of which will be incorporated into our action plan. So Thank you to those entities, and thank you, Vivila, for your presentation. I do want to take a pause though before I go into my next segment. Any questions on Vivila's or the presentation specifically for tribal engagement for our action plan? We're aware that a number of you also have tribal liaisons. So perhaps if you are an entity, a department or agency that has a tribal affairs or a tribal affairs unit or a tribal liaison particularly, if you can raise your hand, we'd appreciate that. All right, so I see OES, CDSS, CDA, Caltrans, Secretary Moss. There you go. Yeah, there you are. Okay. DHCS. Yeah, HCD, CDPH, CDE, and I'm so sorry, CalH. Thank you, Secretary Moss. All right, so all that to be said, I'm sure Vivila has had interactions and intersections with each of your tribal affairs, each of your tribal liaisons. If you've not, this is a perfect example of the opportunity for your position on the council, the charge that we all have to ensure that our respective tribal affairs and tribal liaisons are communicating with each other. So we just encourage that. But we do have some discussion questions. So we'll start first with, how does this feedback align with other feedback you have received about your department or agency's work on homelessness and tribal engagement? And we're really hoping to have a very honest and raw discussion here. You heard from Vivila directly, uncensored. Our tribal communities have a lot of feelings about what the state has done or has not done, rather, to address and prevent homelessness in those respective communities. Wonderful. Thank you. CDSS.
And this is feedback on Vivila's presentation specifically. I can say at CDSS, we have been on a journey to really expand the way that we are able to serve tribal communities. For the Housing and Homelessness Division, I can say we have four programs in particular for which tribal entities and tribes are eligible, and we have engaged in intensive consultation exercises with tribes to make sure that we were positioning those programs to be really accessible and the funding to be really accessible to tribes, and to make sure that we would also be able to develop the kind of technical assistance that we know is critical as they are embarking on establishing the programs and being able to expand them and make sure that they're sustainable and reaching, again, the highest need members in their communities in a successful way. And so a lot of that work is underway now. We expanded over the past year from 3 tribal entities participating in our, again, 3 programs to 3 of the 4 programs to 65 underway. So we are actively engaging in both setting up learning communities for those tribes to be able to learn from each other, but then also providing tailored technical assistance so that, again, as they're establishing programs and ramping them up, they're successful. And specifically, these programs are serving our housing and disability advocacy program, serving adults with disabilities, our Bringing Families Home program, serving families that are child welfare involved, as well as our Home Safe program, which is serving dependent adults and adults with adults that are engaged with adult protective services or equivalent within, again, tribal communities. And then for our community care expansion program, we similarly have an opportunity for tribes to be able to receive funding for development programs and expand housing with caregiving services, which we know is so critical, such a critical gap within for older adults and adults with disabilities in communities. So again, we're on a journey to both expand the services and resources, but also learn alongside all of you and informed with continuous feedback with our tribal partners. So thank you.
Thank you, Hannah. I will say that CDSS was highlighted as an agent or department of practice for its contracting language. We had one entity of many who declined to receive tribal HAP because of our contract language. Their general counsel said that we don't feel this is appropriate. We feel we're losing autonomy. You all should copy the language essentially from CDSS. And so I think this is one example of many that we can bring to the council to say, if you're contracting with the state, you should be contracting with the state, not necessarily individual departments. So I appreciate that highlight. Thank you, Hannah. Yeah, Director Boss.
This is Michelle from Department of Healthcare Services. Just one of the points made about really the evidence-based practices and how sometimes that might be really doesn't meet the needs. Every time we think about that at DHCS, we also try to think about community-defined practices. And so in all of our grants and program designs, it's kind of both to really think about what the community needs might be as well.
And I'm sure Vivila could speak more fluently to this, but to say, like, we heard very directly from tribal communities that we always don't know what's best. And so communities should be able to define for themselves, particularly in areas of behavioral health, whether it's mental health or substance use. So appreciate that. Thank you. Any other council members before we move to the next question? All right, our second question here is, how can the council collectively and individually as departments and agencies ensure that feedback is considered carefully in the shaping of activities for the new and bold action plan? So there, we'll say, just as a reminder for folks, we have a tribal liaison, we have a LEAB, we have many working groups. And so as you're considering this question, just to say, if you don't already have those embedded in your respective departments, agencies, to think about how Cal ICH can support you in those areas.
I appreciated the presentation. We have visited the Palaban Mission of Indians from the Department of Education, and they've actually hosted us twice. And so I believe for me would be when the council is going on these listening sessions to let members know, then that way we can either try and tag along or so we can reduce on that duplicative efforts. And then I believe we need to do the same thing from the department as we're going out, really extend that. And an example is that we did send information about the statewide homeless conference that was hosted by our homeless educational technical advisory centers. We are embarking on listening sessions. So I know I have a 7.5-hour drive to the Yurok tribe, I think next week. And then we are also going to be going to Fresno. However, we're not focusing on homelessness, but this presentation is making me feel that we need to ask a little bit about that as we're doing these listening sessions on behalf of the state superintendent of public instruction. But I guess to go back to the question, Megan, would be just really informing us when these visits are happening. So then that way we can try and coordinate from our agencies and see if we can attend if that's open.
Thank you, Councilmember McGee. I will say, very noted. These are things that we hope to present to you on a regular basis. These are things that will be on agendized regularly, I will say. Also, happily, I can say that our legislative affairs division is working on incorporating the Secretary of Tribal Affairs onto the council. One question that I was personally asked very pointedly from participants of our listening session is, why don't you have intentional representation on the council? And I had no answer for it. We have many, cabinet secretaries represented. We have multiple departments represented. I had no answer for that, but it was a very easy solution, right? And so we're hoping to incorporate Secretary Snyder Ashtari into the work of the council in this next fiscal year. So thank you for that. Any other thoughts before we move on? All right. Well, again, I just want to acknowledge the work of our CalICH tribal liaison who works on behalf of all of your departments and agencies and coordinates with your respective tribal affairs divisions and tribal liaisons to ensure that we have a unified message in response to housing and homelessness for our California tribal communities. But with that, I'll turn it back over to Claire.
All right, hello everyone. Okay, so we are now moving on to general public comment. Thank you for staying with us. So I'm going to first check to see if there is anyone in the room that would like to provide general public. Okay, great. I'll come to you, both of you. Great. So we will now accept general public comments. Thank you for your patience, and we appreciate council members staying to listen to public comment as well. We welcome all comments and feedback. We would like to remind everyone that we are unable to discuss items that are not on the agenda for today's meeting. Additionally, due to the structure of this public meeting, we will not be able to respond to any questions. However, if you do have any questions for CalICH or the council, the best way for you to get that information is to email us at calich@bcsh.ca.gov. We received public comment written before the meeting, and that was sent out to all council members. So everyone will get 2 minutes for their public comment. We've got the timer up on the screen with the countdown timer, and then I will warn you when your time has expired. For those connected through Zoom, please raise your hand and use the raised hand icon. If you are on your phone, please press *9, and I will come to the online comments after the in-person. All right. So could I have a raise of hands on who has public comment? Okay, great. So the lady in the white, could you please come up? I don't have any notices, so.
We'll just refer to persons as persons. So person in the white.
Sorry.
Yeah, thank you.
Thank you.
All right, thank you for opening this to the public. This was very amazing. I am here representing lived experience advisors from San Diego. Yes, I live here in Sacramento, but I'm here participating. And one of the questions is that we should be in this meeting. And just a comment, San Diego is doing an outstanding job working with the city council and county, going to their meetings and just pushing for a budget to really implement services for ending homelessness. Affordable housing is the goal. There is a plan for 1,000-bed shelter there that we're fighting to get it erased, but it's on the plans. And so, well, I think that's all I have to say. I just don't want to go too over, but I really appreciate all of your contribution and support to affordable housing. And I think this is the #1 issue here. Thank you so much. Oh, so sorry. Yeah, erasing myself. My name is Ariane Dalladea, and with Lived Experience Advisor San Diego. Thank you.
All right, thank you so much. And if you wouldn't mind introducing yourself for the record.
Hi, everyone. Kim Lewis, representing the California Coalition for Youth, and I really appreciate the conversation. I was listening in, and I just wanted to jump in on the conversation around the McKinney-Vento definition and noting that that's elevating an issue that we're having that's at the federal level around how we define our populations, and it's particularly impactful for our young people. CDE recently released some data around their unaccompanied young people experiencing homelessness, and we had over 8,500 youth through the school system being identified, but in our point in time counts, we only had about 654 young people under 18, right? Because that's using the point in time count definition. And so these are very different, and that's partly why the state has been a leader on around the definitions of homelessness for young people and mapping to the McKinney-Vento definition, because so many young people end up being hidden and stuff, and so we tend to miss them, right? But then they grow up, and so when they're on their own, these are our most particularly vulnerable young people, and we have very, very limited resources for them and ability to serve them. And so I just wanted to bring that to your conversation and attention, and how we we look at our youth who are experiencing homelessness, and then thank you.
All right, thank you. Any other public comment in the room? All right, great. So we will move to online public comment. Okay. Ileana Chavez, I'm going to allow you to talk. You have 2 minutes.
Hello, can you hear me? Just want to make sure my audio is going.
Yes.
Okay, thank you. Thank you, Council, for allowing the space and for this conversation to happen. I'm Ileana Chavez. I'm the Director of Tribal Programs here at CCRH, California Coalition for Rural Housing. If you do not know us, we are a nonprofit statewide organization advocating for affordable housing in rural communities and tribal governments. We are a TA provider for tribal HAP and have been partners with Paula, Band of Mission Indians, and with Northern Circle Indian Housing Authority, and with countless other tribes for many, many years to improve the access to state housing programs. Tribes have only had access to state housing programs since 2019 with the passing of AB 1010. And there's this expectation that tribes should expedite in addressing and solving their homelessness crisis in that little month. And so they're giving little funding, they're given little timeline, and they're being consulted even less. And I want to say that as much as there is well-intended people at each department, there's still harm being done by the way that these programs are being implemented through the guidelines, because as much as we want to be realistic that these people are also putting into their unconscious bias of what a tribe is or what a tribe isn't, being paternalistic of what is the best outcome or how they should be doing homelessness. And so just wanted to be cognizant of that and try to take that and eliminate that. So when we're coming back into making sure we're getting community comments and addressing that we do that in a genuine and respectful way. I want to point out that tribes have been paying attention to all these state programs by oversubscribing, like the RAPE program, the tribal home key program, tribal HAP have all been oversubscribed these moments because tribes are really working it and trying to get access to these funds. Thank you.
Thank you. Okay, next is Marty. I will be allowing you to speak. You have 2 minutes.
Thank you. My name is Marty Omoto. I'm a dad of a 31-year-old son, Alex, who has Down syndrome and also is has autism and also behavioral health needs, and also a family member. My older sister, Elena, had developmental disabilities, and she died in 2003 when she was in her 50s. So I spanned the entire lifespan of being a caregiver all my life. I'm almost 70 years old this year. I just want to first thank you, everyone on the council there, for the work you're doing. I was really impressed with the updates, but also the updates from the Lived Experience Advisory Board, and and everyone else. So I applaud you for your work. I did send him written comments earlier before the meeting, so hopefully you got that. It's about the inclusion of the Department of Developmental Services as part of the council. I think that's an oversight. I think that needs to be corrected. And I want to make sure that when I look at you and my son looks at you, that I can see all the agencies and departments and programs that provide services. My son got services from IHSS, Medi-Cal, behavioral health, and the regional centers. So let's not forget what was said at the beginning of this meeting. We're looking at the whole person. But that said, I just want to say I really applaud and appreciate all you do. It makes a tremendous difference. So thank you very much.
Thank you very much, Marty. Okay, Ludmilla, go ahead and unmute. You've got 2 minutes.
Hello, this is Ludmilla Bade. And the first thing I wanted to say is I'm well aware that we're going into challenging times budget-wise, and I'm so thankful for each of you, for the work that you're doing, for the collaboration and the persistence that you have. And I really wanted to just, if I could wish you anything, I would say that you continue to have the persistence and the courage to carry on this work as best as you can. Even if there's, well, changes or whatever you can, those of us who are out there, each of us starfish appreciates what you can do for as many as you can do it for. I'm on the eye out for kind of low cost things that can help a lot. One of those I really feel is a place for the input of the people who are served or affected, the people who are homeless, people who have had a service, people who have been swept in an encampment. How can you right now there is no really safe place to share the data, to share the actual experience. Those of us, it's kind of like you don't feel safe telling the provider because then you could be targeted. So having a safe place for that, and I don't know if the lead could recommend that, or if Dr. Cashel could recommend how that data could be compiled. That would be big. A 211, you are welcome here, that people could access services, find resources where they are actually welcome would be an incredible help. And I am really concerned about, well, I'm concerned about too many things that I don't have time for today. But thank you all for your great work. And I look forward to seeing you next time.
Thank you, Ludmilla. All right, Janelle. You have 2 minutes. Okay. I will move on to the other. Okay, I see we have Anna Lee. So Anna Lee, please go ahead and unmute. You have 2 minutes.
Hi, I just want to thank you for giving us the time, space, and the voice, opportunity to be heard with tribal issues that we so desperately need to have elevated. I just want to I just have a couple of comments, and the one is we're talking about best practices earlier, and I want to commend Vivila, who has been fantastic. We've also worked with CCRH, and they are great. I just want those best practices to be kind of geared over to HCD, because I know that people move in and out of positions and they don't really understand tribal history, and that's really, really important. Especially with working with tribes and tribal programs. A lot of the times they want us to give up our sovereign immunity or waive sovereign immunity, and we do not want to do that. We should not have to do that as a tribal government. I think on the state side, they really don't understand our position, and I think understanding the history of the tribes is the most important, because the lack of education is critical to these programs. Also, I know that policy is driven by data, and the lack of data for the tribes is a major issue. We are trying to work on our programs as a holistic approach, meaning that the tribe, we're not only a housing resource center, we're not only providing housing, but we're also social services. We have many, many roles, and just acknowledge that the tribes are sovereign, acknowledge that, the tribes have been developers, and we shouldn't be adhered to, if you're not a developer, or if you're not considered a developer, you can't apply for these programs. Whatever the programs do to make it more difficult on the tribe, maybe not even intentionally, is kind of diverting the tribes from applying for the programs, because there's so many barriers attached, and these programs should not have all these barriers attached, especially when it comes to tribes and us needing to help our tribal members. Thank you.
Thank you, Anna Lee. I'm going to go back to Janelle to see if it was a tech issue. Janelle, if you are able to hear us and unmute, please go ahead.
Thank you. It was a operator error. My name is Janelle Ager, and I want to talk about criminalization and lack of housing. And actually, I don't want to talk about it. I just want to highlight the fact that I sent an email, and I would ask that you forward that to the lived experience group, if possible. And take this opportunity to just tell you a little bit about myself. I have lived experience as a child and when I was in college. With homelessness, it was nothing compared to what is happening now. I have a background in tenants' rights and civil rights, and in elementary education. And since 2011, in various ways, I've been involved in the homeless issue. It began in front of the courthouse when a group of us, it was during the Occupy, and there was a group of us that said, no, we are not going to leave because of the homeless people that are staying here. And I was one of the people that agreed to do the 1 a.m. to 10 a.m. So I was there when the police officers came at times to remove the people. At times I was helping people leave in the morning. And after that, since that time, I've had, as I said, various experiences. But for me, the main thing is for people to have a place to live. And I think there's an ability to do that in the form of campgrounds with tenancy. This is housing first. This is best practices, except for the fact that, as a tenant advocate, I have some problems, but I'm comfortable with that. As a tenant advocate, I agree having tenant rights is important. Better than an encampment, better than dealing with Martin B. Boise. So that's all I have to say. Thank you all very much for your work, and enjoy the rest of your day.
Thank you very much. All right. Javon, go ahead and unmute.
Hello, everybody, and thank you so much for moving this work forward. Just want to bring up the fact that we need to put a spotlight and really elevate the need for more services in regards to youth under the age of 18. As we are currently dealing with the challenge of adult chronic homelessness, our greatest solution to ameliorating that is by ending youth homelessness. And with that, as an individual with lived experience, it was under the age of 18 youth service provider who provided me with those critical services when I was 14 years old. So this is critical. It is necessary and needed, especially when the numbers of young people who are identified within our school systems is going up. So again, please elevate the need for more services for youth under the age of 18. Thank you.
Thank you very much. And with that, I see no other hands raised and no other hands in the room, and I will pass it to Megan Marshall to close us out.
Thank you, Claire, and thank you, council members and members of the public who have joined us virtually and in person. I just want to acknowledge that CaliSH is here as a supporting entity for each and every one of the state departments who have investments, whether those are services or financial investments in preventing and ending homelessness. We're here to support you. So please expect for Cody and his team to be obnoxious, I think is the word I'll use, in our persistence of reminding you of that, and our invitation to utilize us and our staff and our expertise to help you in those areas. I will also say that we are happily hiring for 2 staff service manager 3 positions. One will oversee public affairs, the other will oversee policy and innovation. So if you have staff who are experts in the areas of housing or homelessness, or who have connections to persons who could best suit these positions, we'd be happy to have their applications. And so with that, I will say, I don't have my script in front of me, but I will say that without any further questions, that this is the end of the CaliSH council member meeting on June 12th at 4:19 p.m. Thank you all so much.